Good morning, everyone. I am Montgomery County Council President Gabe Albornoz, and today is Tuesday, January 25th, and we will be meeting as the County Council of Montgomery County. We're going to start our day with a proclamation. This is recognizing Radon Awareness Month, and it will be presented by my colleague and friend, Councilmember Rice. Just a quick point of privilege here. Councilmember Rice, as the chair of the Education and Culture Committee, has been doing some really heavy lifting this last month. And I just want to publicly thank him for his continued leadership and being such an important connection with our schools, particularly during this extraordinarily and unprecedentedly difficult time. So thank you for your leadership, Councilmember Rice, in so many different ways. And with that, I turn it over to you to present this proclamation.
Well, thank you very much, Mr. President. That means a lot, and I know that there's so much more work to be done and look forward to working with you and all of our colleagues in the county executive, as well as MCPS and all of our partners, because there's so much more work, as you said, that continues to need to be done. I want to start off by welcoming our guests that we have with us today. That's Stan Edwards, the Chief of Energy, Climate, and Compliance Division of the Department of Environmental Protection, and Adriana Hochberg, who's Acting Director of the Department of Environmental Protection. I want to thank both of them for their continued commitment and leadership. As you heard from the As you heard from the Council President, when it comes to ensuring that we are keeping our residents safe and doing everything we can to protect them, this is one of those initiatives. Unfortunately, we had to postpone from an earlier date this proclamation. It was supposed to happen earlier in January, but it's never too late to talk about the challenges associated with radon and the dangers of radon gas. Radon is the second leading cause of cancer in the United States, and it's an odorless, colorless gas, and its presence is undetectable unless you are doing a test to look for it. Otherwise, you would not know that it's there. And it was Montgomery County who was categorized by the EPA as having the highest levels of radon, highlighting the need for vigilance on this issue. So when we look at regions where we see a susceptibility to radon, Montgomery County is right in the crosshairs. Previously, we passed a radon bill in 2015 that required the sellers of single-family homes to actually test their properties for radon and disclose those results to potential buyers. With its passing, Montgomery County actually became the first jurisdiction in the nation to enact a law requiring single-family homes to be tested for radon prior to being sold. We should be proud of this accomplishment, but we know that there's so much more that we need to do. And just last year, my office became aware of a resident who found abnormally high radon levels in his rental property. And so there is a need for us to start talking and thinking about ways in which we can continue to protect not only our single-family home owners, but our renters as well. So I want to turn it over to Mr. Edwards or Ms. Hochberg to say a few words, and I'll turn to our interim director first. But did again want to thank them for our partnership, wanted to thank the Montgomery County Realtors and GCAR, because they did a phenomenal job in working with us to make sure that we had a bill that worked for everyone in the process. And so, and then all of my advocates with our various communities that are out here each and every day highlighting the dangers that are here and asking local government to do their part to step in to keep residents safe. So with that, Director Hochberg.
Thank you very much, Councilmember Rice. I really appreciate you championing this important issue. Getting your home tested for radon, it's simple, and it's the law to get your home tested for radon prior to sale. You can find radon test kits on sale at the local home improvement stores, and they're only around $15 to $20, so it's an affordable test to undertake. I can personally attest to it being simple to do. I tested my own home for radon, and the test kit came with very easy to follow instructions. It gave me and my family peace of mind having tested our home for radon, and I highly recommend it to others.
Thank you very much, Mr. Edwards. I know you were a key part of this, sir, when we passed this, and helped us with language, helped us in work, and you still, to this day, continue to help when it comes to folks understanding the law and why it's important. So let me turn to you for a couple words as well.
Thank you, Councilmember Rice. I agree with you. This is a very important issue and a simple one to address. Your legislation has been of great interest to advocacy groups that I speak with on a fairly regular basis. A lot of jurisdictions and organizations that support radon activities ask, how did we get this law passed? And I say, well, we had a very interested council member who pushed it forward. And so happy to give you credit and for what we've done. I think it has made a difference. Just this morning, I checked 311, and 2 out of the 3 service requests that I had were related to radon. So it definitely makes a difference, increasing the awareness of people about radon and its importance. Look forward to continuing to work with you on this issue.
Well, thank you very much. I really appreciate that. And again, appreciate the partnership with DEP. Really want to thank each and every one of you and the department for all of your continued great work in highlighting. I've seen the notes that have been across the highways, reminding people of Radon Action Awareness Month. I've seen the literature that's gone out to educate people about it. And when we bought our home, it was a pleasure to actually see that that was a part of the settlement agreement papers that needed to be signed and the information that was there associated with testing the house for radon. So it works. We see it working in our community. It is not a hindrance to our sales, and it is a great thing in keeping our community safe. I did just want to thank, for my colleagues that are watching and for some that are watching at home, let me just say thank you to Angela Yu, who is our former council member for a day, who actually put together this proclamation. It's a proud moment to actually see one of our council members for a day coming back and working with my office and putting all of these issues together and working hand in hand with the council. So council member for a day certainly extends beyond just right now in the moment, and certainly sets you up for a future in being involved and engaged in government. So thank you, Angela. I'll start off reading the proclamation, which starts off, whereas 1 in 15 homes across the nation has radon levels above the recommended guidelines, and the Environmental Protection Agency has designated Montgomery County as a Zone 1 area, which has the highest potential for critical radon levels. And whereas Montgomery County was the first jurisdiction in the United States to enact a law requiring single-family homes to be tested for radon prior to being sold, because the only way to know if a home has elevated radon levels is to test. And whereas January is National Radon Action Awareness Month, a perfect time to promote radon awareness, as testing is most effective in cooler weather months when houses tend to be closed up for warmth. And whereas the U.S. Surgeon General recommends that every home be tested for radon because testing is inexpensive and, as you heard from Director Hochberg, easily available through the mail or local home improvement stores, and reasonable steps can be taken to reduce radon levels to mitigate health risks it poses. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland hereby proclaims January 2022 as National Radon Action Month. And be it further resolved that the County Council urges all of our residents to test their homes for radon, and if necessary, make simple but life-saving improvements in their home or building to lower their health risks. Presented on this 25th day of January in the year 2022, signed by myself and our Council President, Gabe Albornoz. Congratulations, and thank you again for all of your great work.
Thank you so much, Councilmember Reese, and safe travels while driving into the office this morning. Thank you to Mr. Edwards and Ms. Hochberg for joining us this morning. That was an important proclamation. We will now break until we begin our general business at 9:30. We'll see you all then. Thank you. Colleagues, just a personal note here. My iPhone decided to update itself last night. Good morning, everyone. I am Council President Gabe Albornoz, and today, once again, is Tuesday, January 25th, and we will now commence the general business of the Montgomery County Council. Before we get started, I know that a number of my colleagues today are wearing navy blue in recognition and honor of our friends in the Magruder community who have obviously been through so much these last several days. We want to first thank Montgomery County Public Schools, our first responders, the faculty, the teachers, the staff, the students themselves, and the families and parents who we know have been through so much. We stand with all of you, and we know there will be a time and space over the coming days and weeks to reflect on what occurred on Friday, but this council stands ready to support in any way that it can. So wanted to begin with that note, and I do believe today we are all Magruder strong. So with that, we now move on to our general business. And Madam Clerk, are there any announcements?
Yes, good morning, Mr. President and council members. There is one announcement. The public hearings on the FY23 capital budget and the FY23-28 capital improvements program will be held on Tuesday, February 8th, 2022 at 1:30 p.m. and 7:30 p.m. and Wednesday, February 9th, 2022 at 1:30 p.m. The council has not received any petitions, Mr. President.
Thank you, Madam Clerk. We will now move on to the next item on the agenda where we will sit as the Board of Health. We do have an extensive agenda sitting as the Board of Health today, so I'm just going to provide a quick overview of our plan. We will first receive an update from our colleagues in the Department of Health and Human Services and Public Health team. We have an hour for that update, and so I'm going to humbly request to my colleagues that we limit our comments to the 5-minute rule so that we can get to the two public hearings that we have later this morning. First, on the discussion regarding the county executive's proposal about the vaccine mandate at certain places of business. Following that public hearing, we will have, I will issue a statement regarding that particular proposal, and then there will be some discussion. We will then move on to the next public hearing or formal introduction of the possible extension of the mask mandate, and then have a public hearing about that, and then a discussion and action among my colleagues as well. So with that, I want to welcome Dr. Bridgers, Dr. Kroll, Dr. Stoddard, as well as the other members of the team, and Mr. O'Donnell, who's here as well, to give us an update on the current situation on the ground with regards to Omicron and just general operations. After the presentation, we will begin the Q&A. And again, colleagues, we're going to limit it to the 5-minute rule so we can try to stay on time. With that, I turn it over to our public health team.
Good morning, Council President Albornoz, Council Vice President Glass, and the Council sitting as a Board of Health this morning. Just a couple of points, about 6 of them, before Mr. O'Donnell runs through our pulse report regarding our operations and any additional updates regarding our case counts, hospitalization, test positivity, and the great work that we're doing with our rapid test and PPE distribution in the community with our partners. Yesterday, we have a new resident on board, Dr. Mitchell Legg. He's a preventive medicine resident who's with us for the next week. As in previous cases and assignments from the Uniform Services University Hospital Health Services with our residents, we've asked them to particularly look at specific cases, specific medical cases, and or research regarding where we are currently or where we may be in the future with our COVID research. And I've asked them to look at our the long-term effects of COVID in adult cases. He's doing that examination now. He's working with our communicable disease and our hospital systems to look at the long-term effects of COVID. As I informed council during the last session, Dr. Slepsky looked at the long-term effects of COVID in pediatric cases. So now we're looking at how those cases will impact adults as we look and continue to assess our community level transmission and our recovery from COVID-19, moving from a pandemic posture to an endemic posture. And so ongoing conversations will be presented to council sitting as a Board of Health regarding those efforts. There's a new sublineage of the Omicron variant that was detected in a study as I read yesterday, or Dr. Kroll and I discussed yesterday, in the United Kingdom. It's the BA2 sublineage. There's inconclusive evidence regarding its virulence and transmissibility, whether or not it aligns with the current strand of the variant. And so our ongoing recommendations will continue to assess the impact of any variants or sublineages in the community, as well as those preventive and re-evaluation measures that should continue to allow us to respond either from a public health posture or from a community level posture if in fact those cases would rapidly increase as we see additional strains being presented. We will have a child care town hall scheduled for this Thursday, January 25th, from 6:30 to 7:30. We know that there have been a lot of discussions and conversations about the most recent interim guidance that we've set forth and we've revised based on CDC and the Maryland State Department of Education and the Maryland Department of Health. We look forward to this discussion and conversation to provide clarification regarding that guidance in the interim. The child care provider PPE and rapid test kit distribution and any additional concerns that have been presented to HHS, such as the timely response and issuance of that guidance. So we look forward to having a conversation and just unpack some of those concerns and address those concerns. We've had great conversations the past couple of weeks with our Nexus Montgomery hospital systems, where we talked about acute care and ICU bed utilization. I am pleased to say that in our response and recommendation to the Maryland Department of Health, we have a high throughput drive-through testing that's operational on Monday through Sunday from 9 to 3 p.m. at our Montgomery County Germantown sites. This will allow some relief in our hospital systems as far as the emergency rooms and those urgent care settings where we've seen them being overburdened, much similar to the demand and response that we've addressed at our community level sites. We continue to assess. I know the council will discuss the recommendations to extend the indoor mask mandates, but we continue to assess various models as set forth regarding those projections when we will see a decrease in case counts in the county and align those projections with our recommendation to council, sitting as a Board of Health, looking at either a 7-day average or hospital rates or case rates or test positivity. So we will continue to make that assessment and conduct that research and analysis to present to council sitting as the Board of Health. And as I indicated last week, we will continue to revise our draft plan of our pediatric cases for those 2 to 4-year-olds. We will work with our Maryland Department of Health partners to provide our pediatric guidance to them, similar to our 5 to 11. We know that there may be some community level concerns as to whether or not parents, guardians will want to have their 2 to 4 year olds visit our site to go to their own private pediatrician. And so we're working on that. Similarly, it will be a strategy where we will address or assess our county level hubs, look at school sites, to look at large child care providers. So stay tuned for that. We are putting that together now in anticipation of having a 2 to 4 year old vaccine available within the next month or so. And as we've done with all of our cohorts and our vaccination strategies, we have stayed ahead of any projections to afford us an opportunity and flexibility to be able to administer those vaccines once they are approved by FDA, once they are confirmed by the CDC's ACIP, and we receive clinical guidance from the Maryland Department of Health on the administration of those doses. So I'll stop there and I'll turn it over to Mr. O'Donnell for a run of the Pulse report.
Thank you, Dr. Bridgers. So a brief update to what we've been seeing as we reported at our recent meeting where we began to see some decline. That decline has been steady on a number of metrics. One of the larger metrics has been the test positivity rate has come down significantly. Again, we'll share that there's likely some impact to this from two additional places. One is the very, very high rate of testing that occurred in the county and across the region and the country right around the holidays. That frequency of testing has come down a bit, as well as within our county, the large distribution of rapid tests. However, we're seeing, as you can see from this chart, the positivity rate has come down across the state as well as within the county, and that's very positive. That's welcoming news, seeing these rates come down. Along with the positivity rate, we're seeing lower total number of cases being identified. That's come down quite quickly. Again, a lot of individuals are using rapid tests to determine if they are positive or not. And again, we realize that the guidance we've pushed out and that is available to folks when they register those rapid tests through the county portal or through the state portal should be giving them direction on what to do as far as isolation and additional protocols. Our hospital bed utilization, which is one of the rates that is independent of the overall testing strategies, that has also been coming down, which again gives us even more indication that the Omicron phase, at least the initial Omicron phase, is in recession within our county. Hospital beds with a COVID diagnosis is down to 24.5, which is still just about higher than last winter's peak, but it is moving in the right direction. The overall number of individuals in the hospital with a COVID diagnosis, our acute numbers continue to drop. They are down to 228 individuals. Our ICU numbers still remain at a fairly high level, again, similar to where we were last winter, with 75 individuals in the ICU with a COVID diagnosis. There are 73 additional patients at the alternate care site in Tacoma Park. We continue to track deaths as well. Unfortunate with this Omicron phase, although because it's affected so many more people, we've seen a rise in the total number of deaths in the county and across the state. And we are hoping that those numbers will start to decline, but this rate typically trails the trending figures with case identification and acute care cases. And to share what we've seen with the Maryland database numbers on deaths, we've seen an ongoing downward trend with proportion of deaths in Montgomery County compared to the state. That trend has gone up a little bit with Omicron, but it still is right around half of what the county's population would indicate as part of the state. We do think that the county is doing slightly better than other places, largely because of some of the social practices that our populations have been doing as far as distancing and mask wearing, as well as the high vaccination rates and most importantly, the high booster rates of vaccinations. Looking at the overall vaccination totals, we have seen the county get very close to that 85%. This is a rounded up figure here of the total population having received at least 2 doses, and 46% of those who have received 2 doses have received a booster. Certainly not all of those are currently eligible, but the vast majority are, and we're continuing to recommend those individuals who have not gotten a booster should come out and get a booster, as that has been seen to be the most protective thing you can do to keep yourself from if not getting COVID, then from having a severe illness and a hospitalization. The county's services have continued to provide a high level of PCR testing, even with the distribution of rapid tests. And we're seeing that still the majority of our vaccinations have been in the booster range, although we saw an uptick of our pediatric vaccinations over the last week or two. With the rapid test distributions, we have ordered more than 2 million rapid tests. We have additional quantities that have come in from state partners, and we've distributed or allocated just about all of the rapid tests that have come in. Right now, there is a little bit of competition at the national level and federal level for these rapid test kit orders, and we are waiting on our next distribution of rapid tests to come in. Currently, more than 450,000 have been distributed through the library distribution partnership. As of last Friday, we began distributing masks, either N95s or KN95s, through the libraries. We've also been doing it through childcare distributions, and we'll begin today, I believe, with our private school distributions and some additional community partners that are helping us get masks and test kits out to harder to reach populations. So we have more than 245,000 masks that have been distributed in the 3 days that we've been doing that at the library sites, with an additional quantity given out through our partners. We've also distributed out more than 240,000 rapid test kits to MCPS. That number may actually be a little bit higher with the most recent distribution, and 60,000 test kits have been allocated for our childcare and private schools. Roughly half of those were given out last week, and again, we'll continue to distribute them this week. We also have an online portal to report the rapid test results. And then just wanted to touch upon the most recent guidance that's been issued by HHS. This was in follow-up to the guidance that was released by the Maryland Department of Health and the CDC. The guidance that we have released is remarkably similar to the state and federal guidance. The only area where there is a slight deviance is that because of the under 5 population not being eligible for vaccination yet, and the concern about ongoing spread in that climate, which could in turn result in additional people being contracting the Omicron variant and being subject to further isolation, further quarantine, and in an effort to limit that, for under 5 individuals who are exposed, we've made it a condition that they need to test negative to return early, whereas the state guidance does allow that. If you can't get a test, you can still return early. In the county, we've gone to great lengths to try to make testing as available as possible so that individuals can test negative and come back to that climate. And then the second one is that we are not recommending an early return for positive individuals. And this is largely because there is still some ability to spread the disease after 5 days in positive individuals, even with a resolution of symptoms, and within a population such as a child care setting where the vast majority of individuals are not vaccinated. We're recommending that the children complete a 10-day isolation before returning. Again, this is to limit the spread within those settings to try to avoid further quarantine or isolation amongst those groups. The one last thing we wanted to share was, I know this is coming up more and more with individuals who have been vaccinated outside the United States. We are providing boosters to individuals who have received a full set of vaccination in another country, as long as that vaccine is something that is recognized by the World Health Organization, and they've provided an emergency use listing. If it's not on that list, then we are recommended to begin a new set of vaccinations with the approved vaccines that are available in the United States. So again, whether you're vaccinated here in the U.S. or abroad, we are providing boosters to those individuals. That's all I have to share today, and I'd like to turn it over to Dr. Sauter.
Just a couple additional, I'll give a little more data for the council members sitting in Board of Health. So on the child care provider distribution, through Saturday, we had distributed to 806 child care centers, a total of 25,449 rapid test kits, and 32,390 and 95 masks. And as Mr. Radon alluded to, we'll continue those distributions this week. We obviously are awaiting additional shipments in this week as well. So obviously, as we get a shipment in, we put it back out. And so I think we're sitting at about 3,000 or fewer kits in the warehouse as of this morning. So it just tells you, and that's not me, we've pre-positioned at libraries, pre-positioned for childcare and community partners, things like that. Send a shipment to MCPS, for example. So these actually 290,000 up to MCPS with the delivery that goes out today. So just to give you some additional context, but we're trying to get it in the warehouse, get it out of the warehouse to the partners, because we view the kits as being more useful in the hands of people who need them, as opposed to sitting in our warehouse waiting for something to happen. So we've gotten a few requests from some community partners. I know I've heard from some, for example, the only farmers market reached out and said, hey, we'd be happy to distribute masks. We're reaching out to them to see if they can partner with us as well. Different organizations have reached out. We're working with them for mask and or kit distribution, depending on what community they serve and how much of the resource we have. But obviously, we've been very pleased to see people come for the kits and come for the masks in significant degree. And we have plenty of the N95 masks, so we're obviously getting those out the doors as quickly as we possibly can. And Libraries has been incredibly effective at doing that, as have our community partners. A couple of things I want to note. So if you will have seen, the CDC is in the process of updating its vaccination dashboard. It now features prominently vaccination with a booster. You will also see that our fully vaccinated number, according to CDC, dropped back to 83.5%. I suspect, but do not know. I suspect this is in large part due to them cleaning up some of the data around what's a second dose, what's a booster, and what's a first dose. We've talked about how that data collection process across the country is very challenging, given that people are getting vaccinated in different states, and the states largely control the data that feeds the CDC. So the CDC is having to work those things out. But you can see that there is a percentage of people fully vaccinated with a booster. I do not know why CDC is tracking that. I don't think, we don't have any information, unless Dr. Bridgers does, that they're going to make an imminent conversion over to using boosters as a more complete definition of fully vaccinated. But candidly, I would not be surprised if they change the definition of fully vaccinated over the coming weeks or months. And this may be in part a prelude to that determination. So I think it's just important for us to recognize that we don't control the CDC dashboard. We don't provide data to the CDC dashboard. That largely comes through the state of Maryland. We feed all of our data, vaccination, up to the state. State provides it to CDC, and CDC takes and mixes the different states together to figure out exactly for each person what level of vaccination they've achieved. And so I wanted to answer that question that we've received from the public, but also from Councilmember Friedson. He reached out as well. So I think that's all I have for this morning. We're happy to take questions.
Dr. Kroll, I think you have a couple of
Apologies.
Thank you, Council President Albernos, and good morning. And let me start by sharing your concern and thoughts about the students and the families at Magruder this morning, and prayers going out to all those that have been involved in this process. And a thank you to the teams that have worked so hard to try to keep our students safe in the schools. Two things. Just one is, in anticipating a question, we are continuing our work on identifying a candidate for health officer. We are conducting interviews as we speak, and hopefully we'll be able to provide the county executive with a list of candidates that he can interview and move forward in that decision. I just want to anticipate there may be a question about it, and just let you know that we are still working on those issues. The other one is that last week you heard from county from MCPS during the Board of Health a request for additional support in dealing with the Omicron outbreak in the schools, and wanted to let you know that we have since gotten a formal request to acknowledge that we've since gotten a formal written request from the school system for help with both case investigation and with supplying rapid tests. On the case investigations piece, we have worked with our contract providers and our team to extend the work that has already been done, but being done by the testing team, to extend their role to include some of that case investigation work that the schools have requested. It's not full coverage, but we will be partnering with the schools because this is obviously an all hands on board situation. And as we come out of the spread, it'll get a little easier. But we've added an additional, I think, 90 people to help with that process, so that will extend their capacity and our own reach into the schools. The schools requested a biweekly distribution of 190,000 tests, which is something that we are not going to be able to do at that level. We'll continue providing 50,000 tests a week to the school system. Our sense of this is that there is a number of our families, a number of parents have been able to procure tests through our libraries, through REC, through a number of the other vehicles that we work to distribute through our partners. So we're having to make the choices that Dr. Steiner can speak to, I think, in depth if necessary. But it's at this point, it's a distribution of a limited resource across a wide variety of requests from senior communities that we've gotten requests from on this call, from members on this call, to communities that have been hardest hit and impacted by COVID. So we will continue to supply them with tests at some number. I do understand that they have resources that they are working on purchasing some additional tests, and that may be, between the two of us, we should be able to meet the need as we come out of this surge. And I don't know if there's anything else on that, but I wanted to share those two things with you all this morning. So I'll stop there, subject to any questions people may have.
Thank you all so much. And Dr. Kroll, you did anticipate my two questions, so I'll be able to yield most of my time to colleagues. Colleagues, again, we're going to try to limit this to 5 minutes each. Then just text me if you want to get back in the queue so that we can move along. I'll just make a couple of comments up front. First, to Dr. Kroll's last point, I want to thank the town of Poolesville and the commissioners and volunteers who distributed more than 4,000 rapid test kits and N95 masks just this last weekend. That's one of many examples of the partnership HHS and the executive branch have fostered with our community to expand our reach into all corners of the county. And so I want to thank everybody for your leadership there. Just to confirm once again, Dr. Bridgers, the town hall is on Thursday night with childcare providers?
That's correct, Council President Albernos, on Thursday night with childcare providers from 6:30 to 7:30.
Okay, and if a humbly request of my colleagues in the executive branch, if you can let our colleagues in the delegation know about that information as well, so they can disseminate through their various channels, and that way we can get more people out. So with that, I now yield to colleagues for your 5 minutes. I've got two who have raised their hand thus far. First, Councilmember Friedson, followed by Councilmember Reamer. Councilmember Friedson.
Thank you, Council President. First of all, just want to reiterate my solidarity in thinking of the Magruder community today and joining all of us in doing so. Appreciate the comments and the fact that you joined the Poolsville distribution. We've got a number of responses from constituents about how successful that was, and just want to thank the executive branch for your responsiveness to that request. The child care town hall, very glad that is happening. I think it's overdue, so really appreciate you stepping up to do that. There's been a lot of confusion from providers and from parents, and so hopefully this can help to alleviate that. I just wanted to understand whether or not parents are going to be included or invited in that, or if that is just for providers themselves.
So my understanding is that it will be inclusive. Our partners in emergency management and Homeland Security is setting it up as they've done before. Dr. Stoddard, that's my understanding. Is there anything else that we are aware of, or we need to make the recommendations? We can, but it's an open forum for not only parents and providers.
Yeah. So the only thing I think with parent, I saw those requests on social media last night and have no objection to parents being involved. Obviously, we just had to figure out how, how we had to figure out how we would systematically make it work, because we want to make sure the childcare providers' questions are preferentially answered. Meaning, it's only an hour. I don't want to have, the important questions of the providers missed in this process. So
I fully understand that. At the very least, if parents can watch live in real time, even if they're the ones asking the questions, I think it's important that they hear the answers, from the horse's mouth, so to speak. And I think parents deserve that. So I understand the concern of time, but I think it's very, very important that parents have access in real time to that, even if they're not permitted to ask questions live, and they can follow up with our offices, and we can.
Sure.
Yeah, that's fine. I think it's totally reasonable. We'll work on figuring out how to do that.
Appreciate it. Please share with us information on that in terms of access as quickly as you have it. There's tremendous interest, obviously, as you know. Thank you for that. Appreciate Dr. Stoddard, you mentioning the data discrepancy at CDC. I know there's still some questions and confusion on that. If you get any further information, Dr. Bridgers or Dr. Stoddard or Dr. Kroll, please let us know. But I noticed that, a number of constituents have noticed that, and obviously we're paying close attention to those numbers. Just wondering, Dr. Bridgers, if you could share with us where we are in terms of the modeling that you've shared with us previously, in terms of getting through Omicron and the case numbers. We saw where the numbers are headed, but how does that align with the modeling that you had shared with us previously in terms of the expectation that we would peak about this time and the numbers would start to go down, and we would be effectively through Omicron, at least in early February?
Sure. Thank you for that question, Councilmember Friedson. So again, we continue to assess almost daily our statistical modeling for projections when we will see a decrease in not only case counts, but those other primary indicators and secondary indicators that we use, such as case count, test positivity. We know our vaccination rate is high, which is one of our primary indicator, but also looking at our secondary indicators, such as hospitalization, our ICU beds, our acute care beds, and our COVID utilization. And so in looking at the modeling of the updated model that I received yesterday, projects along a mid-February timeframe. However, the recommendation from the health officer to extend the indoor mask mandate extends 30 days. Now, I know there's only 28 days in January, but it allows us an opportunity to, for any flexibility. I indicated that there is a variant that's being monitored, the BA2 Omicron sublineage. And so we will look at the impact, although those data are inconclusive right now. But looking at the modeling that we've used, we wanted to have that model inform some of the projections as we meet with council sitting as the Board of Health. Our primary indicators as referenced in the Board of Health, such as case count and test positivity, are those primary indicators. But as we see a decrease in those case counts or even hospitalization utilization, in our discussions with our hospital partners, as Mr. O'Donnell indicated and Dr. Stoddard alluded to, is that we're still seeing high numbers of utilization in our ICU beds, and those individuals may have presented for some chronic illness, but they're testing positive for COVID, and so our bed numbers are still high in that case. So all these metrics we've taken into consideration, and we've provided a recommendation to council sitting as a Board of Health so that we won't have the inflexibility of an off-ramp, an on-ramp, looking at a 7-day positivity rate as we've done. We continue to use CDC metrics as a guide for our recommendation, and we're continuing to assess the validity of the data as it's being reported by the Maryland Department of Health. We've also continued to manage MDH's ramp up to provide us with up-to-date data through their COVID data link portal. So these are all of the metrics that are taken into consideration as we make those recommendations to council sitting as a Board of Health. So we try to present a more realistic, a more flexible, and a more preventative posture to protect the county for any increases such as we saw with Omicron. Omicron was a rapidly spreading variant, and so we were able to address that. But looking at those pandemic states and how it will impact us in an endemic state are also considerations under review.
I would just add, I think we all agree that things like mask mandates should be reserved for when we experience surges, right? I think that's the key thing that we're getting to. The question is, when is the surge over? We are certainly on the better side of where this needs to be. The question really is around exactly when. The rates that we have today would still be alarming to us if we were back in November. It's just that we got so much higher, when during the other holidays, at the end of the year holidays. And so we're just not back to where we feel that there's a comfortable level of hospitalization, particularly, but also the cases and positivity are still coming down. We're still over 10% positivity, which for many parts of this pandemic would have been unheard of. And so obviously once we get through the remainder of the surge and get the cases back down to a more reasonable, manageable level, I think that many of the interventions that we've been utilizing can fall away.
And also just to add, as Dr. Stoddard indicated, we're still in a high transmission rate. Typically, when we've looked at assessing a need for an indoor mask mandate, we've been at a moderate to a low-end moderate rate. And so we're looking at modeling, or the models that would provide some indication when we would return to those levels, as well as from our epidemiology team looking at our reproduction, our not numbers, and we're still above 1. So there's still community level spread. And so those are yet other metrics to consider regarding this recommendation.
Thank you, Dr. Bridgers. I know Councilmember Friedson's going to go back in the queue. He has a question as a follow-up regarding those metrics, but just honoring our time commitment here, we're now going to move on to Councilmember Reamer, followed by Council Vice President Glass, and then Councilmember Friedson, you're back in the queue after that. Councilmember Reamer.
Thank you. Well, first thing I want to say is that we are getting through this. Thankfully, this surge, sent cases skyrocketing. One of the tweets that I'll remember for the rest of my life I saw a couple of weeks ago was, everybody has COVID, and all the people who say they don't have COVID have COVID. We got through an incredible moment where lines were out the door and around the block at testing centers, and it seemed like half of the people we talked to, had caught COVID. And that is now coming down. And I think for those of us who are vaccinated, and especially those of us who are boosted, the impact has been manageable. And I think we need to keep in mind just how protected we are with vaccination. And just continue. Vaccination is not the only answer. Air circulation is crucial. Masking in certain settings is crucial. But I am relieved to feel that we are moving forward here and this is subsiding. And I'm looking forward to, in the coming months, a burst of energy and a reclaiming of our lives again. And I hope dearly that that's where we'll be. I would like to just say briefly on the tragedy, the school shooting at Magruder. There are many solutions. One of them is helping our kids get back to some kind of normal life, helping them back to playing sports again and back in their after school programming and back into conversation with adults, that isn't as strained and tense as this January crisis has been with Omicron. And, we've got to reopen that mindset where kids and coaches are talking and they're able to pop into the therapist's office and they can chat with a teacher after class, and we've got to talk to our kids about sharing information and reporting what they see and what they hear in school. And, we need those kinds of safety campaigns with the kids. The kids can help us solve this if they share what they know with an adult. And I think that has been just severed with Omicron. We have once again had to retreat, and we need to regain that context for our lives. Again, it's not the only answer. It's not the only cause, but I think it's important. And yesterday we had a joint committee with the EC and Fed committee. We talked about after school programming and doing a surge of effort around after school programming, just as an example. That is part of the answer. It is unquestionably part of the answer, giving kids opportunities to live, productive lives, sharing information with one another, having those conversations that maybe leads to a safer environment. Third thing I wanted to mention, thank you, Dr. Stoddard, and to the HHS team for responding on the childcare situation. I have spent the last week responding to constituents, particularly parents, but providers as well, with their sharing their concern about losing their jobs from repeated 10-day quarantines and their inability to balance their working obligations with their the fact that they have no care. We've got to clear this up. So thank you. Please move urgently. I hope that a written communication, if there hasn't been a letter to go out, could go out urgently. It needs to happen sooner than Thursday, quite honestly. I just got an email from my son's math teacher. He's going to be missing school because his son, who's in childcare, has been quarantined for 10 days. And there are no substitutes. So this entire math class is getting no instruction, I think, or minimal instruction, because the teacher has to quarantine or has to take care of, an infant who's quarantined. So, this issue needs to be addressed because my understanding is that would not necessarily be consistent with the county guideline for quarantining of under fives. Please, move quickly to share your standard. As I read your standard for childcare, it seems just fine to me. It matches, all the guidance that I've seen, but it's not being properly understood. So if you'll please, again, have written communication that narrates this so that it is clearer. I think that would be extremely useful. I also wanted to ask about the, anticipated outcome, anticipated case issues. Councilmember Friedson asked the same question. What should we expect? I've heard some conversation about a plateauing. So again, I think you answered that. Basically, we have seen these 2-month cycles, and it could be that it plateaus a little bit higher than what we previously would have thought was low. But at the same time, again, Dr. Stoddard, Dr. Bridgers, any comment you want to make about what a projection could be for the next couple months?
Sure. Thank you, Councilmember Reamer. Just a couple of things to back up. And yes, we've made our child care guidance aligned with CDC and MBH. But one thing I just want to share this morning is that where MSD and MDH may have indicated early on in October the use of rapid test kits to allow our children to return to child care earlier, we've implemented that now since we have rapid tests available, and we know that that is effective measure for children to return. And we realize and understand, and we research the impact on families. So I just wanted to share that as part of the comment.
To your point, Dr. Bridgers, it's after 5 days from an exposure, rapid test to return.
That's correct. For individuals who are not positive, those individuals who've had a close contact.
Right.
So we're recommending. Go ahead.
No, I just wanted to say,
sure.
The Children's Hospital of Pennsylvania has been a guiding light for me throughout this pandemic. And they are now saying for childcare, treat it symptomatically, not asymptomatically. Respond to it based on symptoms. So they would go further than we are. I just want to observe that. And it's the same for K-12. They have the Children's Hospital of Pennsylvania's recommendations are more return focused than our guidance. But I'm sorry, Dr. Bridgers, please continue. That's it.
And no, that's fine. But I also want to add that our guidance is set forth as an interim guidance, again, looking at our community level spread with a high transmission. Once those community level spread, those variables are reduced and go back to a more moderate level, if you will, we will address those guidance and revise those guidance again. So this is an interim guidance. This isn't something that's set. It's set to be more preventative because we know that cases that there's a 31% as described by the American Medical Association. There's been studies in the United Kingdom where we know that there's exposure as high as 50% in some individuals post 5 days. And so we've taken all of those metrics into consideration. When we see our community levels transmission reduce, we will revise those guidance again. This is an interim measure to protect those who are unvaccinated. According, as Dr. Stoddard indicated, according to CDC's numbers of 83.5% being vaccinated, there's still 16.5% of Montgomery County residents, to include children, who are unvaccinated. We know that data clearly demonstrates and indicates that those individuals who are hospitalized are unvaccinated, not only in Montgomery County, but in the state. And so we take all of these metrics into consideration as we set forth our guidance. Now, the question has come up repeatedly about the health officer, and as Dr. Kroll indicated, we are actively seeking a health officer. However, we continue to use our medical residents, our public health advisory team, which consists of 6 medical doctors, all stemming from preventative medicine to pediatric doctors to individuals who are healthcare epidemiologies in their usual vocation. So we continue to consult with them to ensure that we have the best response for Montgomery County. And it's evidence. It's been demonstrated in our metrics that we've prided ourselves on for the past almost 22 months now. So I just wanted to share that with you and council this morning. But going back to look at those metrics and the modeling, we may not see a plateau as indicated in previous variants. What we're seeing, or what we saw was a rapid increase in cases, and we're seeing a decline in cases. Now we see blips in the cases where it may be 1,000 cases one day and 800 cases another day, and then down to 300 cases, but it may go up. We continue to test as a high volume. And so with our modeling now to be more realistic, if you will, we're looking at mid-February. However, we don't know and have data that's inconclusive right now if that's an absolute or whether or not it will be the 3rd week in February. So we've set a timeline that allows us more flexibility as we continue to assess the data on a daily basis.
Thank you so much, Dr. Bridgers. And Dr. Stoddard, I'll give you the final word here. We got to move on because we've got other colleagues that want to speak. So Dr. Stoddard.
Yeah, I think Dr. Aziz Shah, the chair of Brown's School of Public Health, put a great thread out last night, laying out where I think he expects us to go. And I think I largely align. We're going to have a large number of immunized people, both because of Omicron and because of boosters. I expect that the totals will come pretty low in February and probably get lower as the cooler months get behind us. And so I think that's sort of but I think it's a best guess. It's a guess, but that's what other wise people besides us are saying.
So we've got two colleagues who've asked to be in the queue in addition to Council Vice President Glass. Councilmember Fried's, I ask if you can ask your follow-up question at the end so the other two council members who haven't spoken yet can speak. Council Vice President Glass, followed by Councilmember Hucker, and then Councilmember Navarro. Council Vice President Glass.
Thank you, Mr. President. Good morning, everybody. I first want to echo the sentiments by my colleagues about childcare and the ongoing confusion there. I recently had a constituent contact me as recently as yesterday, trying to figure out the rules and regulations with their child care provider. And so I had to forward them the ordinances and the updates that were online. And so let's keep sharing that information because clearly there remains a disconnect. Shifting gears a bit, Dr. Bridgers had said in his opening comments that we need to move from a pandemic posture to an endemic posture. And I absolutely agree with that. I think that is the question that the country and the world are dealing with right now. And in order to make that shift, we need as strong a team as possible. And everybody on this Zoom has been working overtime, using their staffs and all their resources to keep our residents healthy and safe. And over the last number of months, we have still been without a chief health officer. And I know that Dr. Kroll, in your comments, you alluded to the ongoing search. Can you elaborate a little bit more as to why we still have not hired a chief health officer?
So thank you, Councilmember Glass, Vice President Glass. We continue to do a search. This process under normal circumstances would take an extended period of time. So we have gotten to the point where we're interviewing candidates and identifying a pool of candidates to choose from is not out of pace with where we would normally be. We tried to accelerate it because of COVID. We of course ran afoul of the ongoing challenges of COVID themselves. The other thing is that we have a group of candidates that are faced with some interesting challenges. I mentioned last week that we had one of the prospective candidates who decided to no longer be in competition for the position. And that had to do with a combination of personal choices about where they were in their life right now, the ages of their children, but also had to do with tied directly to the degree of the demand of the job and the increased demand of the job under COVID during this time of a pandemic. We're dealing with folks who have to make a decision about this in the face of the pressure of being constantly on the hot seat for making decisions and trying to make recommendations, but also dealing with the fatigue of identifying potentially some of the candidates are in health officer positions, and so dealing with the fatigue of thinking about moving to another position that is new after having been in that crucible for the past 2 years. There's also, of course, endless levels of fatigue about the politicization of every decision and the questioning of every decision that a health officer and/or the health officer's team has to make about and a recommendation around that. And that has been kind of an endless process across the country, as you've seen, no doubt. So the important thing, again, I want to say to folks is that we have a team of folks. No health officer does this alone, that we have a team of people that are constantly discussing, weighing the facts, reviewing the research, and making recommendations to now Dr. Bridgers in that process. So it's not a one-person operation.
Absolutely, and as I noted, that you are all part of an incredible team, and I appreciate you. I know we all appreciate you, and the simple fact is that public service is not easy these days. But I want to pick up on something that you talked about. You talked about some people shying away from accepting this position because of the vitriol, the hate, and the attacks that are being levied on public health officers, not only here in Montgomery County, as was evidenced by the hate spewed upon Dr. Gales while he was here, but we know this is happening across the country, and it is inhibiting our ability to fill out our team so that we can continue keeping our public healthy and safe in a way that we decide. And we can all disagree on public policy. And this council has been listening to the robust debate underway about how to keep our community healthy and safe. But we need people to treat some of our public servants with a level of respect and understanding. Otherwise, these positions are going to be going unfilled. And I think it's important to elevate this point because it is quickly becoming a vicious cycle where people are stepping up, wanting to help serve their community based on their community relationships, based on their world-class education, but they are fearful to do so. And I'm not talking about the elected officials. Forget the elected officials. We put ourselves out there. I'm talking about our doctors and other medical professionals. And so I think this needs to be a clarion call that we need to change the tone, not only here in Montgomery County, but across the country, and allow our public health officers and our other public servants to rise to the occasion to try and help all of our residents. I see, Mr. President, you've unmuted, so my time is up, and I'll yield back.
Thank you, Council Vice President Glass. Important message. Councilmember Hucker, followed by Councilmember Navarro.
Thanks, Mr. President. Great question, Councilmember Glass. So last week, we heard from the superintendent how much help she feels like the system needs with contact tracing and the resisting the spread in the schools. I appreciated Councilmember Reamer's real life experience, and I often try to share what I hear from parents and educators, but I'm motivated to share this experience of my own. So last week I was contacted by my son's school and got a call in the middle of the day. He had a close exposure in second grade in the middle of the day. So they asked for consent, which I'd already provided, and said they'd call back if he tested positive, would not call back if he was negative. So no news is good news. I'm hoping I don't get a call. I get a call a couple hours later, assuming it's bad news. It was, but not the bad news that I was expecting. It's they're calling to tell me the bus broke down and I need to come pick him up to take him to after school. So when I'm in the car with him that I'm lucky enough to own, unlike a lot of my neighbors, and lucky enough to leave a job that I can leave, unlike a lot of my neighbors, I ask him how his COVID test went. And he says, Dad, what are you talking about? I didn't have a COVID test today. So if I had never picked him up at school and never asked that question, I would not have found out that he was not tested. I would just assume he was negative. So that's 3 problems just in one day: avoidable exposure, the bus breakdown, and the failure to test, not to mention the failure to communicate the failure to test, just with one kid at one school, and at a school that's lucky enough to have a staffed health clinic, unlike most of our 209 schools in the county. So I realize not all those failures are in your purview, not MCPS's. I called the front office with this new information to confirm whether they knew my son was not tested for the COVID he was exposed to, and they were not aware and could not tell me if they had or had not, if he had or had not received a test. So I hope that helps you appreciate what we're hearing every day from parents and students and staff about the confusion, the miscommunication in our contact tracing efforts. Can you clarify just what is the process supposed to be for notifying parents and guardians of a student's close contact exposure in school and the test results?
If it's okay, I can jump in here and start, and then others can chime in as well. So what we have been doing, let me provide a couple of pieces of information. What we have been doing is a number of school staff have collaborated with health services staff to be able to facilitate the contact tracing process. We've been working very closely with DHHS over the course of the past week and a half and have made a lot of progress in terms of DHHS staff or contractors being able to assume more responsibility for contact tracing. And I anticipate that we'll be able to share more details with the council.
Jimmy, I'm really glad you're here. Last week, I was heartened to hear the superintendent ask for help with contact tracing and to get MCPS staff out of the business of contact tracing. You're saying you made a lot of progress this week. Could you help me and my colleagues understand what's that progress look like?
So we are working with DHHS, and we'll have something in writing that we'll be able to share. Again, it's a process of working out the details, but the piece I really wanted to clarify, if it's okay, was about the testing. So typically, and I'm not sure, and I can follow up on the individual school circumstances, but typically if a student is designated as a close contact and then the parent gives permission for a modified quarantine option, that means that the student is then going to be participating in the next round of screening testing, whichever day it's scheduled for. It typically would not be that same day unless the screening testing was scheduled for that day of the week. So in any case, I will reach out to your office just to get more information so we can find out details about what occurred. In terms of the piece with contact tracing.
Well, just call me. I don't think my staff don't know this. I'm disclosing it here freely.
Okay, so I'm happy to reach out to you directly.
Sure. I don't think my kid's school is special in any way. So that makes me worry about the other parents of the children in his class and other classes and the other 208 schools around the country, around the county. How are school administrators notified of every student who receives a test and the results? And how do schools track those results?
So it's important to know that there's really multiple different forms of testing. So obviously the testing that happens in the health room is the rapid testing for symptomatic students. And then there's collaboration with the health room staff and the school administration. For the screening testing, that is handled separate from DHHS through the state vendor that MCPS is working with. And the state vendor, the state covers all the costs. The school system doesn't bear it. In that case, the school system handles, or administrators or other staff handle the responsibility of getting students to the location for the testing. So in this case, if they're using that modified quarantine option, typically that would be the process on the next day that the screening testing occurs. So I definitely apologize about the challenges, and we will follow up to get more information about what exactly occurred. In terms of the work with DHHS, like I said, there is a lot that has happened and there's more work that's to be done. The bottom line is there are DHHS contractors. They're going to be assuming a lot more responsibility, which makes a huge difference for school administrators.
Glad to hear it. I'm sorry, I don't want to cut you off. I just don't want to lose my 5 minutes. It's very brief. So back to Dr. Stoddard. Thank you, Jimmy. You all pledged to monitor how DC and Baltimore are doing implementing test to return to make sure we separate the infectious students and staff. I know as a PhD in infectious medicine, you understand the importance of that from everybody else. Baltimore tells me they're very happy with their system. Why don't we just use that?
Wait, that's Dr. Stoddard, before you answer, just I know there are people who are waiting to speak for the public.
Oh, am I over my 5? I'm sorry if I am.
It started about a minute ago. We thank you all for your patience. We will get to the public hearing as soon as possible. After Dr. Stoddard answers that question, Councilmember Navarro has a question, and then Councilmember Fritz, I'm going to ask that we follow up offline on your follow-up question so we can get to the public hearing. So Dr. Stoddard, please respond, and then Councilmember Navarro, you will be on.
Yeah, we've been getting updates. We've actually been tracking what's happening in Baltimore and DC on a few times a week basis, watching both the data come in and also just the news reports. And I think there's a lot of confusion about what Baltimore City is doing. They're not doing they're not doing everyone test to return every week. That, just so we're clear, they allow for an opt out. They have a lot of people opted out. Let's go that way in terms of their testing. And so they're doing numbers. They're doing fewer testing in Baltimore City than actually MCPS is doing on a regular basis. DC did their single test to return when they came back to school. They are now obviously doing similar screening with saliva-based testing, utilizing their opt-out process that the DC law allows for them to do. I think there's still some discrepancy, certainly from MCPS's attorneys. They can certainly chime in on that around the opt-in, opt-out question in Montgomery County Public Schools. But long story short, I think that they've been similarly successful. Like their COVID rates were comparable given what our community rates were. I think the community rates largely look like your schools. I don't think schools are drivers of transmission. I think schools mirror transmission that's in the communities. And I think the transmission seen in Baltimore City Public Schools largely mirrors what Baltimore City's experience, and same is true in the district.
Thank you.
Thank you so much. Councilmember Navarro.
Thank you, Mr. President. Well, first of all, as a district council member that where Magruder is located, I want to again express my heartfelt prayers for the victim, the family, and all of the Magruder High School family, staff, students, parents. Also want to thank our police department, MCPS, our health and human services department, everyone who has stepped up and continues to step up to address this horrific incident. And so, as some of my colleagues have made comments about just theorizing on the impact of this pandemic, I just want to go back to some of my initial comments around the need for all of us to put forth some updated, I think, protocols and scenarios, because this notion that somehow everything is just going to go back to normal, I think it's a fallacy. I think that we have been affected in ways that we never even could envision, and our systems also have been affected tremendously. So I appreciate every single person here. Somebody talked about, respect for health officers. I think that respect and grace needs to go all around. Respect and grace for employees, for elected officials as well, for our community, because this is just not something that anybody has a, magic answer for that is neatly able to solve everything that we're trying to solve, but everybody's working very hard. However, I do think that it would be a mistake for us to think that we may not be hit again by another wave, or that something else may not come our way. And so I wanted to make that comment. My question was answered, and it had to do with the childcare piece. But I do think that we need to think very bold now around these issues of support for our students, proposals like a wellness center in every high school. That's the kind of bold approach that we need to think about. Street Outreach Network, staff tied to those wellness centers in each high school. That's the kind of bold response that we need to look at. We can't continue to do piecemeal approaches, because this has been a very significant instability that has been created in our society. So I just wanted to have the opportunity to state that, and again, as a district council member, to really thank everyone who responded so quickly. But we need to acknowledge and own that the mental health issues, the poverty issues in our communities, the extraordinary disruption, it's something that we may not have completely understood or being able to measure. And we are going to have to take up some really bold steps here to at least begin to provide some stability as we move forward. Thank you for letting me have the opportunity to make those remarks.
Thank you, Councilmember Navarro. So thank you to our public health team, and thank you to our colleagues at MCPS who joined us in the end. We will have our colleagues from MCPS join us next week as well, sitting as the Board of Health, where we'll have an opportunity to ask extended questions. Keep up the great work, everyone. We now move on to the next item on the agenda, which is a public hearing regarding the resolution to adopt a Board of Health regulation to prevent the spread of COVID-19 in the county, vaccination requirements to enter certain businesses, including bars, restaurants, recreation centers, and other covered establishments. Before we get to the public testimony, I just want to mention briefly, as I noted yesterday during the Council President's press conference with the community, with our media, that the majority of my colleagues at this point are not prepared to vote on this resolution right now. We were very appreciative of the county executive's recommendation, and also the 2 work sessions in which we have received feedback from both the community and the businesses who are going to be charged with implementing this. And there are still questions about the ability for us to be able to effectively implement this at this time, given the challenges that we have before us, and an interest in seeing how the District of Columbia's rollout of this initiative goes as a point of reference to ensure and determine whether or not it works, and see what the logistics are as it's rolled out. So we will not be voting on this today. There are no immediate plans to bring this before the council vote. So I just wanted to make that note, and colleagues will have a formal opportunity after the public hearing to make comments about this, but I just wanted to say that up front. So Ms. Salou, thank you. I'm going to turn it over to you to manage the public hearing process now.
Thank you, Mr. Council President. Good morning. We have about 18 speakers for this public hearing. Our first speaker is Mr. Rob Crouch. Mr. Crouch, you have 2 minutes, and you may begin when you are ready.
Okay, thanks. My name is Rob. I live in Aspen Hill, and I'm against this proposal. So I can talk about how there is essentially no evidence that passports slow the spread of COVID, but I want to focus on the real reason why this has been proposed, and that's to remove personal health decisions between a parent and a doctor, hand those decisions to the council, and to force the 5 to 11-year-olds to get vaccinated. During last week's working session, it was said that the rates for these groups were too low, and banning them from these public places will force their parents to get them vaccinated. What kind of leadership is that? Threatening parents that their kids cannot partake in society if they aren't vaccinated? This is far beyond any reasonable or ethical boundaries that the council, acting as the Board of Health, should ever have. Does the council know better than the FDA, the World Health Organization, the United Kingdom, Finland, Norway, all who have had their reservations about mandating or even giving these shots to this age group? Even DC, which you say you are doing this because they are, does not force 5-year-olds to get vaccinated. Maybe these rates are low because parents are hesitant to vaccinate their children with a shot that hasn't even been fully approved yet, because they know this age group is at an overwhelmingly low risk for severe COVID. How many kids in Montgomery County have died from COVID so far? It must be in the hundreds, or else why would you be indirectly mandating these shots? Well, it's 0. 0 people under 20 years old have died from COVID in the last 2 years here. In fact, only 1 person under the age of 20 has died in all of Maryland. There is no rational reason to force these kids to either get vaccinated or be banned from public life. Let their parents and their doctors decide. So public messaging on this vaccine from every level of government has been terrible this whole time. The best way to convince someone of the merits of something is to explain its benefits and its risks, and then to give them free will to make a decision. Forcing people into something implies that you fail to convince them otherwise, and this really harms the confidence in the vaccines. People will either just dig their heels in deeper or suddenly have a very strong, sincerely held religious belief. As of yesterday, 89% of the eligible county population was fully vaccinated. If this rate, basically 9 out of 10 people, isn't good enough for the council, no rate ever will be, and the passports won't help that. So thank you.
Thank you for your testimony. Our next speaker is Ms. Diane Fitzgerald. Ms. Fitzgerald, you have 2 minutes, and you may begin when you are ready. You need to unmute your microphone, ma'am.
Sorry. Good morning. Vaccine passport mandates are punitive, unjust, and zero data support that they drive down COVID transmission. Evidence shows the vaccine does not prevent illness or transmission. I'm vaccinated and recently had COVID, like many people we all know. The mandate is discriminatory and government overreach at its worst. Councilman Friedson nailed it when he said, "It's clear there are no comparable jurisdictions or peer-reviewed evidence to determine the efficacy of this." In 2 years, science has transformed COVID from an inpatient illness with poor outcomes to one that is manageable as an outpatient for most people. It is not the same virus, so we should not treat it the same. Do not cherry pick data points or cite an old study to support your position. You must look at all of the robust, recent, peer-reviewed evidence in similar populations. Vaccines and treatments should be decided between patients and their doctors without government involvement, period. Privacy must be protected, so no one has to show a card or explain his status. Celebrate progress in medicine. Every day, doctors are finding ways to help patients recover from COVID with the many novel and even older drugs. Help make these treatments readily available to everyone and do not dissuade their use if doctors see a signal of benefit. Give people hope and stop spreading fear. The over-the-top fear is unhealthy, irresponsible, and irrational. A passport will not magically eliminate COVID nor make people safer, rather give a false sense of security. Help our children to not grow up in fear because we showed them how to do it. Be an example. And empower people to get healthy, to reduce the comorbidities that make any illness worse, like obesity, smoking, inactivity. This will prevent more than just a complicated case of COVID. Listen to your constituents who have spoken and don't pause this vote. Vote no today and be done with it. Thank you.
Thank you for your testimony. Our next speaker is Ms. Megan Montgomery. Ms. Montgomery, you have 2 minutes and you may begin when you are ready.
Good morning, members of the County Council. My name is Megan Montgomery and I both live and work in Montgomery County. I'm a proud registered Democrat and a primary voter. Last year, I moved my multi-million-dollar-a-year business to Montgomery County from DC because they are anti-business and I thought I would find a more hospitable home for my business. This proposal proves me wrong, and rest assured, I can move my business right back out of this county. In addition to my direct revenue stream, I bring an additional 6 figures a year to my market with hotel and restaurant spending. I assure you I will be taking that spending elsewhere should this nonsense go into effect. Please tell me how many members of our county hospitality industry have come to you saying that they can afford to lose 6 figures of business. This proposal is anti-business, it's anti-science, it's anti-people who operate businesses in Montgomery County. I barely have the ability to hire people now to actually do my legitimate work, let alone hiring Bolshevik paper checkers to harass my members who pay thousands of dollars a year for my services. You may all sit here and laugh and joke about how this is simply the only way you have to raise vaccination rates in the 5 to 11-year-old demographic. Shame on you. How dare you play politics with my livelihood and laugh and joke as you drive the county to financial ruin. Councilman Jawando, you ran on the horrifying promise to mandate the warehousing of our 4-year-olds in office buildings without playgrounds or even appropriate bathroom facilities, against all evidence that has any long-term impact on our children. You would continue to ignore your own promises and the actual science of this pandemic that says that 80% of our county vaccination rate would mean getting back to normal. You ignore your constituents, you cancel and rearrange your meetings, and you hide in your house as the rest of us try to keep revenue coming into this county. Please tell us, members of the council, how many millions of economic activity do you personally create for this county? Councilman Reamer, you've spent months calling the county executive an anti-vaxxer because he was not willing to do a mandate. Now when this is on the table and you can't take the heat, you turn your back on your voters and your ire. Do you think we're all so stupid that we forget your past taunts? Over and over you change metrics.
Sorry to interrupt, ma'am. Thank you for your testimony. Our next speaker is Mr. Brendan O'Leary. Mr. O'Leary, you have 2 minutes and you begin when you are ready.
Hey, I'm Brendan O'Leary. I'm the owner, co-founder of True Respite Brewing Company in Durwood, kind of Rockville. I am a business owner who is directly impacted. I am against the vaccine passport regulation. My reasons are far less emotional than the people who came before me. The reason why I'm against this is because, as many of them have pointed out, vaccination is still a choice. And the spread of Omicron, which is the predominant variant, is not very well inhibited by vaccination. What it does prevent is severe illness. And so in the end, people have the ability to make a personal choice about whether they'd like to be protected or not. But putting the burden of policing that onto businesses at a time when we've already been burdened so heavily by people who are afraid to come out, by taproom closures and bar and restaurant closures, putting the financial burden on us to cover an employee or multiple employees, since we have multiple entrances, to cover folks coming into our business, especially as a place that is a community center where, kids 6 years old, 12 years old, they're welcome to come in. They never walk up to the bar. So I have to have someone seated at the door for all hours, or placed at each door for all hours that we're open to check vaccine passports if I'm going to follow this regulation appropriately. And we simply can't afford it. My on-premise business is down 40% from 2019 when my business was only a year old. That's by far my highest margin product. We do about a quarter of our sales volume in our tap room, but it constitutes about half of our revenue. Every single little hit to the ability of someone or the willingness of someone to walk into our business and order a pint at the bar hurts us, and putting the financial burden of covering and more staff at a time when we're already hurting to cover what the county believes is the collective liability makes no sense for businesses. It makes no sense for the county economically. And I am
sorry
fully
to
opposed.
interrupt, sir. Your time is up.
Thank you.
Thank you for your testimony. Our next speaker is Mr. Andreas Garcia. Mr. Garcia, you have 2 minutes and you may begin when you are ready.
Okay. Thank you. For any council members who, despite the unanimous negative response from your constituents, still plan to vote for this resolution, I implore you. History does not reflect well on those who supported discrimination of any kind. They are never the good guys. That's not to say this resolution is akin to racial discrimination of the past. However, the vaccine passport and mandates equitably discriminate against anybody. It doesn't matter if you're white, black, brown, red, blue, rich or poor, citizen or non-citizen. If you exercise your bodily autonomy and reject the vaccine for now, under this resolution, you must be denied entry to most indoor establishments. So saith the executive branch. There's a word for that, but I'll let you figure that out. Notice I said for now, because science is methodical, meticulous, and laborious. It takes time, often years, to gather enough data to begin drawing accurate conclusions. A single study is not universal truth and can easily produce inaccurate conclusions. Scientific truth comes from the meta-analysis of the totality of studies to determine the consistent outcomes and separate them from outliers. Time will show vaccine mandates and passports to be a stain on human history, an utter embarrassment for posterity. A vote for this resolution is an admission of your authoritarian desires. The mask will come off. Those who took the time to voice their concerns, their significant concerns, and everyone within earshot of us will understand the intentions of those council members who do vote for this resolution. We will not remain silent, and we will not comply. More MCPS students were shot last week than died of COVID. So this is not about health, and it's damn sure not about keeping kids safe. Thank you.
Thank you for your testimony. Our next speaker is Ms. Lori Trent. Ms. Trent, you have 2 minutes, and you may begin when you are ready.
Hello, thank you. My name is Lori Trent, and I'm here to speak about the broken trust between the county council and its constituents. I signed up for the original meeting last week to give testimony against the vaccine passport, but was put on a wait list. However, I did watch the live stream with great interest. What I saw were 20 people that put in a lot of time and effort to give their life experience, show data, speak to science, and give real-world examples of the negative impacts the vaccine passports would have. But what I watched, and what I'm actually seeing today with Hucker having his own little personal conversation over there, Navarro seems to be texting away to someone madly, Katz, who seems to be doing the same thing, is not paying attention at times about the speakers, and then after this was had, seemed to be marched away with seemed to be wanting to implement this. While I can understand that you seem to have shelved this at the time, you don't seem to have the balls to actually just vote it all down, despite your constituents saying that they don't want to have this. You're not representing your constituents. You're wanting to represent your ideals. This same paternalism has been seen with the council members over and over again. We saw it with the defund the police in our schools, our most vulnerable population, despite the outcry of our school principals. This led to a marked increase of violence in this academic year. Many of you are running for re-election or for county executives. Seeing that Montgomery County has closed primaries, these elections are determined in June, not in November. I'm part of a group that is actively working to recruit Republicans and independents to change party affiliation, to participate in voting all of you out based on this broken trust. Elrich won by only 77 votes, and I know of 23 people that have registered Democrat to help clean house. Understand this. With every anti-science legislation you put forward.
Sorry to interrupt, ma'am. Your time is up. Thank you for your testimony. Our next speaker is Mr. Mark Marovic. Mr. Marovic, you have 2 minutes, and you may begin when you are ready.
Okay, thank you. Hope you hear me okay. Yeah, I'm speaking to ask you to reject all vaccine and mask mandates. If they work, there wouldn't be massive outbreaks in schools. And for example, one happened in the school my child attends. So everyone was masked and vaccinated in that case. The CDC director stated that vaccines cannot prevent transmission. CDC also recently admitted that natural immunity protects better against the latest variants. So 95% of the county has at least one shot, but still the county recently had the highest case rate in Maryland. You say the hospitals are full of the unvaccinated, so the mandate should help. At the same time, you discussed that the mandate should drive up the vaccination rates for 5 to 11-year-olds. So what's the average age of hospital patients? And where is the data? Who do you call unvaccinated? Hospitals are not full of 5-year-olds. So why are you targeting the lowest risk population? Take, for example, high school athletes. MCPS has the most discriminatory mandate as the only one of the kind that doesn't allow for religious exemptions. These kids may need sports scholarships to get into colleges. Just like the unfair school mandate, these county mandates would also target different groups unequally. Cases already down from the peak, but now you're distributing N95 masks. Well, they don't stop the virus either. So stop trying to do something and look at the harms of these policies. Mr. Jawanda quoted the French president on wanting to piss off the unvaccinated. Did you get good support for that? At least be transparent on what your real reasons for pushing mandates so hard. Countries are abandoning restrictions and courts are striking down the mandates. So let's not be the last county that lifts them. Thank you.
Thank you for your testimony. Our next speaker is Mr. Michael Davis. Mr. Davis, I would like to know that Mr. Davis will also be speaking on item 2D, so we have a total of 4 minutes for his testimony.
Hi, my name is Mike Davis. I encourage any adult who hasn't had COVID to get vaccinated. I am not a Republican. I am double vaccinated and have now recovered from COVID. This is my vaccine card. I will never be showing this to anyone. It won't just be the unvaccinated in the DMV whose business you will lose, but also the vaccinated who will boycott this county on principle to stand against anti-scientific medical tyranny. And not only the outspoken like me, but there are thousands and thousands of others who will simply not want to put up with this nonsense. And when deciding where they want to spend their leisure time, just look at the cities where vaccine passports are implemented. Broadway is dying as a result. Shows are closing down. Restaurants are dying off. Gyms and bars are struggling. All for what? To pressure an 85% fully vaccinated county to take a vaccine that the CDC now admits no longer prevents transmission? Yes, the vaccines work in preventing severe disease. But if it's now the council's duty to protect people from themselves, why not demand proof of a gym workout to purchase fast food? Why don't we bring back prohibition, ban alcohol? The fact of the matter is, it is not the role of the government to protect us from ourselves. People make poor choices. No amount of government coercion will prevent that, no matter how hard you try. This council are treating the people of Montgomery County like children who need to be told what to do and manipulated into doing so. And speaking of children, how about you stop treating children in this county as nothing more than vectors of disease transmission? We're already keeping kids out of schools, and now you want to exclude 5-year-olds from public life for not having the correct papers? The CDC is already saying the definition of fully vaxxed now includes boosters. Dangerous passport systems like the one proposed will only get more draconian. Take me, for instance. I had 2 shots. I've recently recovered from COVID. There's no scientific justification for me at this point to get a booster. Scientific studies show that taking additional shots post-infection come with a 2 to 4 times increased chance of an adverse reaction to the shot. Google it. Other studies show natural immunity offers 13 times stronger protection than vaccination. Google it. Knowing these 2 facts, what logical reason would I have to take more shots at this point? Yet this vaccine passport system you propose will seek to exclude me from public life in my own county, despite me being fully protected and of no threat to others. Also, it is very likely a majority of this 15% not yet fully vaccinated in the county already have natural immunity, making the juice even further not worth the squeeze by any stretch. Our public health officials like Earl Stoddard are like a hammer, and all they see are nails. There is zero nuance or cost-benefit analysis of what these useless measures do to our social, mental, and physical health. 2 weeks ago, when Stoddard was asked why Montgomery County had soaring case numbers, he said with a straight face, we are only 40 to 50% boosted, with zero evidence to back up this claim. In last week's meeting, Stoddard actually quoted a study all the way back from November about the Delta variant as justification for vaccine passports to limit transmission against Omicron, which the CDC now admits cannot be prevented by the vaccines. Stoddard is either straight up lying or is ignorant. Either way, he should not be holding a position of power. The fact that these councilmen are listening so intently to him is very concerning and shows a giant lack of curiosity. N95s are useless if you have facial hair. N95s are only useful if you have them professionally fitted, air sealed, and only used once. It is beyond unrealistic to believe the general public can make this work, let alone children. Germany mandated N95s and their infection curves looked identical to all the countries without such mandates. COVID is seasonal, and there's no stopping transmission anymore, no matter how many rain dances this council does. Please end the theatrical mask mandate used to score political points. Start treating us with some respect, and let people choose.
Thank you for your testimony. Our next speaker is Mr. Chris Miller. Mr. Miller, you have 2 minutes for your testimony. You may begin when you are ready.
Hello, thank you for your time. Michael just did a great job explaining a lot of the points that I would make, but I'm a business owner. I was born and raised in Montgomery County, and I actually went to Magruder High School, which has made the news recently. My hope today is to encourage you to lead with integrity and not fear. Gabe Alvarez said that the vaccine passport is not the council's proposal, but rather that of Mark Eldridge. If it is never the council's intention to implement a policy of this nature, then please vote against it. The adverse effects are far more harmful than any perceived benefit. Here are a few points to consider. 1, testimony from the Strathmore made it clear that businesses will incur additional costs, and there's no sign of financial assistance from the county. 2, there are so many logistical issues with this. What if someone does not have a vaccine passport or claims religious or medical exemptions? Ms. Kinch, who helped draft this mandate, previously suggested that physical segregation is a viable option for businesses to handle undocumented or unvaccinated people. Pause and think about that. 3, 90% of the county is fully vaccinated. So where does this end? People are worn out with the goalpost of restrictions and mandates being pushed further and further. Earl Stoddard said that the data is soft and not significant on transmission being less among vaccinated people. Requiring people to get vaccinated to stop the spread without overwhelming evidence is a very dangerous precedent to set. Earl Stoddard also said we shouldn't just trust people concerning wearing masks or getting vaccinated, and therefore it must be mandated. In effect, the county's voice of expert opinion on this topic does not trust his constituents. Mr. Stoddard does not have a voting position on this matter, yet you all do. Therefore, please vote against this. Remember, government is of the people, for the people, and by the people. The intentions of this may be good, but there will be devastating consequences. From a born and raised Montgomery County resident, local business owner, please vote no. Thank you.
Thank you for your testimony. Our next speaker is Mr. Grayson Porter. Mr. Porter, you have 2 minutes for your testimony. You may begin when you are ready.
Hi there. No worries. Can you hear me?
We can hear you.
Good. Before you mandate something, you should know what's in it. As of November 30th, 2021, 12 toxic ingredients have been identified in the genetic alteration injections. They were discovered through reverse engineering, patent analysis, and actual U.S. federal agency announcements. Please note, a lot of these ingredients are bioengineered to self-replicate. Graphene oxide, the toughest, most electrically conductive nanocompound known, forms sheet-like structures and microcircuitry in the body, lethal to humans. Blamed for causing injection victims to become magnetic and have their skin slough off prior to death. Luciferase, a luminescent substance that was patented from the chemical structure found in lightning bugs, possible connection to the proliferation of black lights for streetlights. Hydrovulgarus, an immortal, self-assembling freshwater parasite found in all of the injection brands. Some of these are sometimes stained with purple and green, indicating a laboratory origin. Pegylated lipids, a lipid sheath that delivers the graphene oxide and genetic payload. Karen Kingston's early videos on the Stu Peters show describe this from the patents. Ethylene glycol is antifreeze and highly lethal to humans. Pfizer shot is 22% ethylene glycol. Microballs, a cutting-edge microscopic technology. These are black spherical balls or donut shapes. They expand under lights to deliver a payload that forms a black crystalline lattice. Ethertate nano CPUs model Elbreth. The data produced by the injected is captured and uploaded to the government via Wi-Fi. An Ethertate model called Elbreth was used in Russia in their Sputnik generation of genetic alteration injections. Morgellons filaments, a broad array of bioengineered filaments that self-replicate and appear throughout the body after injection. SM-102, a chloroform-encased lethal substance whose MSDS material safety data sheet describes extreme danger should humans come into contact with it in any way. Artificial mRNA or DNA payloads. Thus far, human fetal kidney DNA harvested from dying late-term fetuses without anesthesia.
Thank you for your testimony. Our next speaker is Mr. Larry Haley. Mr. Haley, you have 2 minutes for your testimony. You may begin when you are ready.
Thank you. This is not a debate about whether the vaccines are a good idea or not. The inclusion of 5 to 11-year-olds in the vaccine passport regulation is an attempt to strong-arm parents into vaccinating their young children when they are currently not otherwise doing so. It's shameful and should be rejected. No serious person can say the vaccines are preventing or reducing transmission rates, which is the goal of this vaccine passport system. Mr. Elrich's proposal includes medical and religious exemptions. However, there are zero details about who makes the decision whether an exemption is valid and how a resident will show an approved exemption. Right now, a resident will have to seek a separate exemption at every establishment they wish to enter because private businesses will not have a connected record system. Do we really want residents to have to provide very confidential and more than likely ADA and HIPAA-protected medical information to the McDonald's employee to make a determination as to whether a resident can enter and enjoy a sandwich? The same goes for those requesting religious exemptions. No citizen should have to validate their religious beliefs to anyone. It doesn't get any better if the government is the approver. No citizen should have to pass a government test to enter a public accommodation. County businesses will be exposed to civil litigation anytime they turn down an exemption request. According to the county dashboard, only 45% of residents are fully vaccinated and have the booster. As Mr. Albornoz stated last week, a passport system without a booster requirement would be a symbolic gesture at best and not one that has true public health validity or efficacy. Are we prepared as a government to disenfranchise up to 55% of all county residents from full participation in society? Of course, the highest areas of disenfranchisement will be in Wheaton and Silver Spring because 57 to 70% of those residents are vaccinated at best. If county businesses thought a vaccine passport was a good idea, they would have put such a system in place on their own. They haven't done so, and that tells you all you need to know. I encourage you to vote no to this terrible proposal. Thank you.
Thank you for your testimony. Our next speaker is Mr. Michael Torp. Mr. Torp, you have 2 minutes for your testimony. You may begin when you are ready.
Okay, thank you. My name is Michael Thorpe. I was born and raised in this county and currently live, work, and am raising a family here. I also spent over 10 years working in our local restaurant community. I'm against this mandate and think the data shows it will have minimal impact on reducing the spread of COVID or deaths within our community. I agree with a lot of the objections already spoken against this mandate, and rather than pile on, I wanted to provide some data points that provide different reasons this mandate is not needed. Fact. One of the reasons you're considering this is to push people to get vaccinated, specifically our youngest part of the community, which is the least vax group by age. Fact, per your dashboard, not a single youth 18 or younger has died from COVID in this county. And this is common across the US. Fact, per the CDC dashboard during this entire pandemic, children under 18 make up less than 0.1% of all COVID deaths in the US. Just to repeat, less than 0.1%. And if you're worried about spreading the virus, fact, per the Montgomery County dashboard, despite over 80% of the county being vaccinated during the latest surge, we beat previous COVID weekly case records by over 5x. New York City, with the vaccine passport in place, also had record-breaking surge in cases. While it's beyond clear that vaccines lower the chance of serious illness or death, the data is not showing it reduces spread. And if you're worried about our vulnerable part of the population, fact, per the Montgomery County dashboard, 75% of COVID deaths in this county have been people 70 and older. But good news is that per the CDC website, 95% of people 65 and older in this county are fully vaccinated. Fact, per the hospital website, the wait time at Shady Grove Emergency Room was 11 minutes and Germantown was 10 minutes this morning. It does not seem overrun and in need of such emergency action. If the data I shared, all pulled directly from county and CDC websites, was reversed, I'd be here supporting this mandate. But thankfully it's not. Our county is more than 80% vaccinated, and in the past few weeks, our case count has seen over a 50% reduction. In light of these facts, I think what you're considering today is a mandate in search of a problem that does not exist, and I ask you to vote no on this measure. Thank you all. I know this has been a difficult time with COVID. I appreciate your support and work.
Thank you for your testimony. Our next speaker is Ms. Melissa Ward. Ms. Ward, you have 2 minutes for your testimony. You may begin when you are ready.
Thank you. Good morning, council members. I'm a lifelong resident of Montgomery County, and I'm seriously considering moving my family elsewhere. I took some time to get to know each of you, and I thought I'd make this personal, as it would be for all of us if this is passed. Councilmember Navarro, you stand for equity and social justice. This mandate is the antithesis of both of those things. By passing this regulation, you stand for legalized segregation and legalized discrimination. Councilmember Jawando, you base your platform on something you call the MoCo Promise, which states all Montgomery County residents are entitled to an inclusive community. Would you consider this mandate inclusive? Councilmember Kratz, you owned a small business, a department store that was passed down to you by your grandparents. As a former small business owner, can you stand by passing a mandate that could drive our local small businesses into the ground while large department stores are left to thrive? Councilmember Reamer, in recent blog posts, you use the argument that the unvaccinated are crowding hospitals. However, we know that on January 5th, the CDC changed their definition of unvaccinated to include those that are vaccinated but not boosted. Further, we know that every person is tested regardless of why they're in the hospital. The numbers being reported fraudulently hyperinflate the number of unvaccinated cases, hospitalizations, and deaths, and fraudulently deflate the number of vaccine breakthrough cases, hospitalizations, and deaths. In Montgomery County, 88% of people are fully vaccinated for a virus with a 99% recovery rate. This is not about health. This is a gross government overstep, an extreme violation of privacy and people's right to bodily autonomy. You've heard from Democrat, Republican, vaccinated, and unvaccinated, all in opposition. I personally represent thousands more, as evidenced by a petition we started a few weeks ago that has 5,000 signatures and gaining more by the minute. Vaccine passports are failing everywhere, including New York and all over Europe. You have no ground to stand on to pass this. You work for us, and your job is to represent us. Say no to this resolution. Thank you.
Thank you for your testimony. Our next speaker is Mr. Michael Pavlak. Mr. Pavlak, you have 2 minutes for your testimony. You may begin when you are ready.
Good morning. I've been a resident of Montgomery County for over 16 years, and I am testifying in opposition to the proposed vaccine passport. This past Saturday, I traveled around the county to the different districts and asked people whether or not they support this proposal. I asked business owners, people in parking lots, and people at home. Out of all the business owners I asked, every single one said they are opposed to this proposal. The owners expressed their concerns about how this proposal could bring the same devastating consequences that lockdowns brought. They explained how this proposal could turn away customers who wish to keep their health choices private and force them to move to carry out only again, or worse, shut down completely. I spent 8 hours traveling to 4 of the 5 districts and asked a total of 40 people what their opinion was on the proposal, 5 of whom were business owners. 18 were in favor and 22 were against, meaning 45% of the county supports the proposal. With a population of about 1 million people in the county, the poll can be given a 95% confidence level with a margin of error of 15.5%. This means that if you asked every citizen of Montgomery County, there's a 95% chance that no more than 60.5% is in favor of this proposal. Many of the people I spoke with expressed how they are vaccinated, but that they believe the proposal goes too far in terms of government control. Others said that they don't understand what benefit it would bring, given its ineffectiveness in places like New York City that has had a similar proposal in place for months, but has still seen the same recent surge in cases similar to the rest of America. Most of the people who said they support the proposal stated how they can see both sides of the argument, and they were truly on the fence in regards to the proposal. There were definitely more people extremely passionate about being opposed to the proposal than people who were extremely passionate in favor of the proposal. Because of this, it is very possible that heated exchanges will arise between patrons who do not want to obey this proposal and employees who are simply trying to follow the county's rules. At a time where it is so important for us to be strong as a community and work together, it definitely seems like this proposal could bring unnecessary toxic energy to restaurants and bars, places where people go to relax and unwind. With labor shortages and lower customer volumes, we cannot willfully burden our businesses by passing this proposal. The people are still not vaccinated, feel very strongly about the reasons why they are not. It is extremely unlikely that this proposal will change whether or not someone decides to get vaccinated. They will either leave the county or be unethical and find ways to convince. 30 more seconds, please. 30 more seconds, please. I know you all want.
Thank you for your testimony. Our next speaker is Ms. Elizabeth Stockton. Ms. Stockton, you have 2 minutes. You may begin when you are ready.
Thank you. Hello, my name is Elizabeth Stockton, and I am a 20-year resident of Montgomery County and a mother of 4 children. I and some of my family have been vaccinated, and we all contracted COVID this winter. I was pleased to hear the council table the proposed vaccine passport policy. However, I believe it was tabled to allow for further study. As part of evidence for this study, I'd like to proceed with my originally planned remarks. I've never felt the need to engage in a public meeting until now, but I believe that a plan to institute vaccine passports will be ill-conceived and do nothing to stop the spread of COVID-19. It will harm small businesses and restaurants in our county. To be clear, my family and I are absolutely opposed to any form of a vaccine passport. MoCo has one of the highest vaccination rates in the country, and this does not even consider the impacts of natural immunity. The CDC has recently released a study that shows vaccines are not preventing or stopping the spread of COVID. There is mounting evidence showing how vaccine passports have not worked in places like France, Australia, and New York City. England is now moving away from these policies and recently declared an end to all mandates in the United Kingdom, including masks. Many top scientists believe we are in an endemic stage of this virus. We are seeing how these mandates and passports are not going to stop this virus. We need to learn to live with it, protecting the most vulnerable, leveraging new and effective treatments, and getting back to normalcy. If you were to proceed with the vaccine passports, it would not cause my husband and I to vaccinate our children. Instead, it would spur us to take our business to neighboring counties, and we are not alone in this sentiment. I and my family are not against vaccines, but we are against policies which limit our freedoms as the vaccine passport policy would do. This council needs to drastically change its course and forget about ever implementing a vaccine passport. If you don't, my husband and I will be sure to vote against any of you who affirm this type of decision and work to keep you off the November ballot.
Thank you for your testimony. Our next speaker is Mr. William Lambert. Mr. Lambert, you have 2 minutes for your testimony. You may begin when you are ready.
Good morning. There's no need for me to rehash everything that everybody else has said. I'm against this order with having these cards and requiring these as a mandate. I support everything that everybody has spoken about and shared. It's very obvious that this is government overreach. Montgomery County should be worried more about the education system that's crumbling and the crime that is rising. This mandate did not help in any way, shape, or form. The CDC has already said that how the COVID is spread, how the vaccine does not prevent, it only helps minimize. Asymptomatic people are not spreading or are spreading, but are not in any way, shape, or form helping prevent spread of COVID. So whether if you have a card or not, if you're asymptomatic, you're still going to infect people, you're still going to spread it. And this is not going to work no matter what. We need to worry about every individual having the responsibility to take care of themselves when they are sick and seek out treatment. It does not require government to make those decisions for us and enforce anything of that nature. So I would appreciate your time and would tell you to please do not enforce this as a requirement. Thank you.
Thank you for your testimony. Our next speaker is Ms. Jennifer Lester. Ms. Lester will also be speaking to item number 2D, so we'll have a total of 4 minutes. So you may begin when you're ready.
Thank you very much. Good morning. My name is Jennifer Lester, and I'm an attorney in Rockville, Maryland. I've been representing individuals and businesses in the state of Maryland for the past 16 years. Since March of 2020, I have assisted my clients in navigating the drastic changes we have all experienced in how the law intersects with our daily lives because of COVID. My comments reflect the sentiment of hundreds of individuals I have spoken with over the past 22 months. Thank you for the opportunity to provide testimony against the resolution to extend the indoor masking mandate and the vaccine passport. Montgomery County Code requires that for the protection of the public interest, all legislation provide a fiscal economic impact statement and a racial equity social justice impact statement. When considering legislation such as this that has a drastic impact on public health and individual rights, an independent medical or health impact statement should be required as well. Requiring individuals to wear masks ignores the science, which is not settled, and violates our long-standing constitutional rights. In March 2020, Dr. Fauci, in an interview on 60 Minutes, laughed as he told the American people, wear a mask might make you feel better, but it is not providing perfect protection like people think it is. One day of research into the vast world of experts beyond those reported on CNN, and you will easily find there is little scientific basis for masks. But it's a free country, so wear one if it makes you feel better. At the end of the day, a mask can be removed. An injection of an experimental medical product into your body cannot. In 1990, the CDC established the VAERS reporting database, which, as you know, takes in information on vaccine injuries and deaths. From 1990 to 2021, there were approximately 168 deaths reported per year to VAERS. In 2021, after the rollout of the COVID-19 vaccine, there were over 22,000 deaths reported to VAERS. From 1990 to 2021, there was an average of 1,700 injuries per year reported to bears. During 2021, over 1 million injuries were reported to bears. Yesterday, U.S. Senator Ron Paul, who I know none of you are fans of, and frankly, I wasn't either, but he did have a 5-hour hearing yesterday with experts in the scientific and medical community regarding COVID-19. Tom Rent's attorney spoke of 3 DoD whistleblowers who have come out with data concerning the impact of COVID-19 vaccines on the military community. There's been a 300% increase in miscarriages, a 300% increase in cancer, and a 1,000% increase in neurological problems. In August of this year, Pfizer will be releasing thousands and thousands of pages of unredacted information about COVID-19 side effects they knew about prior to releasing this vaccine into the marketplace. Council members, I suggest to all of you, this is not a public health issue. This is a criminal issue, and you need to treat it as such. And which side of history are you going to be on? Thank you.
Thank you for your testimony. And that wraps up our speakers for this public hearing, Mr. Council President.
All right, this public hearing is now closed. We're now going to proceed to individual comments from colleagues if you'd like to make them regarding this particular proposal. I mentioned as Council President where we are right now in terms of the majority of the council and hitting the pause button as we discuss this. I'm now going to make my own personal comments as one of the 9 members of this body. I really do appreciate the testimony that we just heard and recognize the anger and frustration that is out there. We're feeling it, we see it. I feel it and see it pretty close to home as well. I also especially want to thank, actually it was Mr. Thorpe who had testimony that I think was most aligned with my concerns regarding this particular measure right now. I am concerned about the efficacy of this and whether or not, in fact, it will be helpful, especially given the fact that over 90% of our population is fully vaccinated as defined by the CDC right now. And I also am concerned about the ability of our small and local businesses to be able to implement this, particularly now when we know that there are significant struggles with regards to staffing. And the one-size-fits-all approach, I think, is problematic for a variety of reasons. I do fully support the businesses that have enacted this on their own, including our arts community, which has been able to enact this in a way that has been effective. And by testimony we heard last week during our work session, been effective in helping to alleviate the concerns both of staff, the artists themselves, but also the residents that come and participate in arts-based programming. So for those reasons, I'm not supportive of this measure. And I know that we are going to wait and see how this is rolled out in DC and whether or not it's effective or not. But I just think that there are more cons than there are pros at this time, given not just the testimony we heard, but conversations I've had. And I especially do want to thank our business community and the people who would be most tasked with enforcing this and providing very thoughtful testimony last week during our work session. So that is me speaking for myself with regards to my concerns regarding this measure at this time. I now yield to colleagues who would like to speak. And I would like to now call on Councilmember Reamer, who has requested to speak. Councilmember Reamer.
Thank you so much. Well, there were a lot of misstatements about the efficacy of vaccinations that are just made. And I'm not going to go into that. But just speaking for myself, I would like to see a more workable version of this. I don't think it's reasonable to require a restaurant to hire a bouncer. They just don't have resources right now. They don't have customers. I have also traveled with my family over the holidays. I went to New York. I used this system. I showed my vaccination card with my family, our kids. We showed them. It was not a big deal. And we were comfortable eating indoors during the height of the surge. I think that there is a way to do it, but you can't treat the business community like an afterthought. And you got to work with them on a way to do it that actually can be implemented and addresses some of these concerns. And it's frustrating. We're 2 years in here, and we know that these kinds of issues have to be worked out at the level of detail, and how they'll be implemented. So appreciate my colleagues' comments, and thank you very much for hearing me out.
Thank you. Council Vice President Glass.
Thank you, Mr. President. I appreciate everybody taking the time to share their thoughts with us. I especially appreciate those who disclose their vax status, which I think is really important. And I'm vaxxed, I'm boosted. And the whole point of this conversation is to figure out how to get the rest of our community healthy and safe, recognizing undeniably that those who are vaxxed and boosted have less adverse effects if and when they get COVID. And the data proves that. And so how do we continue keeping our residents healthy and safe? And so the Vax Passport was one way to get more people vaxxed, to force them to get vaxxed, to encourage them to get vaxxed. And I was looking at the jurisdictions around the country that have Vax passports, and the commonality between them is they all have vaccination rates in the mid to low 70s. And the whole point of the passport is to encourage them and their residents to get more vaccinated. And then you look at where we are here in Montgomery County, and we have, as of today, a vaccination rate of 89% fully vaccinated of our eligible residents. And we are leading the nation in terms of large populated counties. And that's a testament to all of our residents of all political considerations. And it just makes me ask, what then is the point of the vax mandate if we have the highest vaccination rate essentially of the country? And that is not to say that there are other things we can't do. We've also know that masks do help. And we're going to be having that conversation later today. There are other ways to mitigate the spread of COVID without taking that measure, because those jurisdictions that have taken the measure are in a far different place than we are. And we are fortunate because of that. And I want to thank all of our residents, 89% of our eligible residents, for getting vaccinated. And for those reasons, I don't support this at this time, but I think there are other things that we can and should do to continue ensuring the health and safety of our general population. Thank you, Mr. President.
Thank you, Council Vice President Glass. We've got Councilmember Rice, followed by Councilmember Navarro, and then Councilmember Jawando. Councilmember Rice.
Thank you very much, Mr. President. And while some of you may be thankful for the testimony that we heard today, I'm actually quite troubled. And I'm troubled because it, again, signifies where we are. It signifies where we are here in Montgomery County, where we are in this state, where we are in this nation. And it has become very clear that it is regardless of what we feel or what we think or what we would like to have happen, that people have drawn a line in the sand. It's very clear from the woman who decided that she would threaten the school board and say that she was going to bring a gun to school if her kid would be required to wear a mask. That's where we are. And so a vaccine passport is not going to motivate, nor force, nor engender folks to either get vaccinated or carry their vaccine passports. We are at an impasse. We're at a place where those who have chosen to get vaccinated have chosen to do so, and the remainder of our community who chooses not so are not going to be convinced. And so what we need to do is continue to provide information and hope that people will make a decision to get vaccinated to protect themselves as well as to protect others. But the reality is that we're at a point where we have to leave it up to individuals. And that's where we are. And so, it's frustrating because for many of us, we see the benefits of having vaccination and what that can do, not only for individuals and protecting them, but also for protecting the greater community. Many of you know that unfortunately I had a family member who was in the hospital with COVID. And yes, the vaccine is not in a guarantee that you won't go into the hospital. It's up there in terms of the protection levels, but as you've heard from people who testified, they've had COVID before. Some of them have been fine. Some unfortunately have not. And we've actually had breakthrough cases where people have had very negative outcomes. It happens, and it's relates to comorbidities and all kinds of other things that are out there. And so we continue to tell people and educate people about what's happening. But the key is that they're also being fed information from other sources. And we can't expect that just because we're saying something means that folks are going to believe what we say and not what they hear from other folks who are telling them something completely different. We've all experienced it in terms of our family members or friends or loved ones who we've tried to convince, yet they hear from others that, you know what, this isn't something that I should do. So what I would ask is that if you have a friend, a family member, a loved one, a person who you care about, a neighbor, who you know is unvaccinated, please have that conversation with them. Talk to them about it. We're not going to be able as government to force anybody to do it or convince them or coerce them. It is up to us as individual members of community and society to work with one another who we care about and we love, to tell them about the benefits and hope that they make the right decision. That's where we are. And so a vaccine passport is not going to get us over that hump, to get those last few people who we need to have vaccinated because we care about them to do so. It's up to all of you that are watching, all of you that are talking to each other, all of you who care about your fellow man. I'll continue to do my part as an individual member of this community, born and raised here in Montgomery County, who really truly believes that everyone is important, that everybody's life is important. And I hope that each one of you will do the same. Thanks, Mr. President.
Thank you, Councilmember Rice. We've got, just a reminder, colleagues, we have a public hearing that starts now, actually, but we're going to wrap up this particular work session. We have Councilmember Navarro, followed by Councilmember Jawando, then Councilmember Katz, and then Councilmember Friedson. Councilmember Navarro.
Thank you, Mr. President. Thank you for giving me the opportunity. I think it is important for us to have a chance to express our concerns and our opinions about this particular proposal that was sent over to us by the county executive. It's important to clarify, of course, that this is the process. The county executive did, sends his proposal forward, and then the county council has to, as sitting as the Board of Health, has to hold a public hearing and has to take in consideration, and usually we vote. That is the process. But I do want to, number one, I think it is important to recognize that, this council from the very beginning worked very closely with our health officers, all of our stakeholders, the community, to figure out what would be the most impactful ways to mitigate the impact of this pandemic. I think that the reason why there is such a high vaccination rate is because everyone came together to identify best practices, and our community partners were extraordinary. Our residents stepped up to the plate. They responded. This is why we have such a high vaccination rate, and we're leading the country in that sense. Obviously, I feel like now we're getting to this point where it's just so difficult to truly understand what exactly we are going to face next. A lot of people in early December, including my family and I, felt that, hey, things are getting much better. We can go out a little bit more now. We can start to relax. So let's plan some holiday gatherings. And then very quickly realized we had to change our plans. My own family was affected by this, Omicron wave. And we are all trying to navigate this. And so to me, this is why this proposal presented so many challenges, because to even think about the impact on our small businesses, especially our restaurants who are struggling right now, and not have anything built in to support this, not understanding why at this point where we have such a high vaccination rate, would we then try to implement something like this? There was just a lot, for me, a lot of unanswered questions about the timing and even the approach, because we've proven that our approach thus far has been quite successful, especially when we talked about communities where we knew we had very low rates of vaccinations, our Black and our Brown communities. We saw how we were able to effectively close that gap. So those are all the reasons why I am not inclined to vote on something like this, to support something like this at the moment in time. I know other jurisdictions have put this forward. They tend to be jurisdictions where there's a very vibrant nightlife, you know, where this is an ecosystem that is quite extensive. And I can kind of understand the rationale for that. Montgomery County is not like that. We're not a city with this extraordinary, you know, widespread nightlife. And those were some of the feedback that I would hear from restaurant owners, especially small restaurant owners, had to do with a lot of that. Just, you know, what will happen? This would just kill us. And so yes, that is the reason why I, in this moment in time, would not, I don't think this is necessary. I think that we need to double down on our public education campaigns, on our initiatives, on working with our partners. I personally, my family, we do not mind showing our vaccination cards if we go to a particular restaurant. I've gone to events where we do that already. It is not a personal challenge or issue for me, but I think that not understanding how the impact will be to implement something like that, given our high vaccination rates, I think that we still have tools that we can implement absent this proposal by the county executive. Thank you.
Thank you, Councilmember Navarro. Well said. Councilmember Jawando.
Thank you. I want to share my colleagues' just clarification and also dismay about some of the testimony, and just re-emphasize that vaccines work. I think one of the things I'm most proud of is that we've taken a consistent stance in favor of preventative measures, and there's no better preventative measure to mitigate spread, but also more importantly, severe illness than the vaccine. And so please, while we have the highest in the country for a large county, we're all proud of that. Anyone who's not vaccinated or boosted, please do so. We're going to talk about the mask mandate shortly. That's also a very important mitigation strategy. And I think it's served us well. Timing is everything. If this vaccine passport proposal was made, months ago, I think I'd have a different opinion of it than I do today. We heard this morning from our public health team, thankfully, the numbers are trending down in the right direction. Our vaccination rate continues to be very high. We're looking at other parts of the country and the world that have implemented these, and everyone has tried to figure out over the last, nearly 2 years, 21 months or so, how do we keep our community safe, mitigate the spread, and layer on the protective and preventative measures to do so. This type of idea, which I do want to say has been implemented and should be respected where it's implemented by private employers or restaurants, theaters that are doing it already in the county, is in effect an important strategy, a layer on top to keep people in congregate settings safe, and where there's where the ventilation may not be great, or there's a large amount of people where you don't know vaccination status. And I think common sense dictates that if you are going with your family somewhere, I, like many people, I have an under 5-year-old child who's not vaccinated. If you're going somewhere, it does make you feel better to know that there's going to be people who are vaccinated there, and that there's going to be masks worn when people are not eating. And I think those are reasonable and logic-based assumptions, and science-based as well. However, where we are right now, I don't think this has been fleshed out enough with the business community. We don't have necessarily the supports in place to support people to have to do this. I think and again, the timing is not right. We're at a different stage. We're in this, hopefully, switching from pandemic to endemic in that process. That's what we hope. But we still have to have mitigation strategies, still need to get vaccinated. So I think for that reason, it's not the most timely and it's not the most fleshed out proposal. And so hopefully that's where we stand and we move into a different phase. If things change, like with what we've always done throughout this pandemic, we'll have to go back and revisit where we are. But I think at this point, that's where I am. And it makes sense to not put this in place at this time and continue to monitor and encourage all of our residents to get vaccinated. So I appreciate it, Mr. President. Thank you.
Thank you. Councilmember Katz.
Thank you, Mr. President. And I'd like to thank all my colleagues who have already spoken, and I'd like to thank everyone who testified today as well. I am a strong believer in people being vaccinated and boosted. I am, and I'm a strong believer that everyone should be. However, let me say very clearly, I am opposed to this legislation and have been really since I first read it. And for those who have said, we shouldn't even have entertained it, we should entertain it. The county executive sent it, and we need to discuss it. And that's exactly what we're doing today and have done for a couple of weeks. We're, and the numbers get a little confusing. We're at 89%, I believe, fully vaccinated. We have some people who've received one, and so we're in the 95% or whatever those numbers are. And at some point, because of the exemptions for people who were vaccinated, because of for a medical exemption or a religious exemption, or those who couldn't get it, young people under 5, we're never going to get to 100%. So if this idea was to get us more vaccinated people, we're not really going to get that many more vaccinated people, and I don't know how this would help in that regard. Looking at the various markets, New York, the District of Columbia, very different markets, as was pointed out by Councilmember Navarro, very different markets than what we have in Montgomery County. I mean, they get many more tourists and other visitors than we do. And it was pointed out that I am a former small business owner, and I say that with pride. And many times my mind goes back to what happens in a small business. And this would be absolutely unfair for any business, especially a small business. Here you can't, in many cases, they can hire wait staff at this point. And we're saying not only do you have to have that person either stand at the door and be a bouncer, or you're going to have to hire somebody in addition during the times, A, that they don't like the legislation, and B, they can't afford to do what is being suggested. So I'm not sure, and I did want to point out that it was pointed out a couple of times that it looks like I'm not listening during a public hearing. That is not accurate. We're on Zoom, and I guess I look down. The way I have my computer set up, it's higher up so that I can be seen directly. But I listen to every word. I don't agree with every word that's ever been said. I don't want to point that out, but I listen to every word that is being said. I make notes. I do what I necessarily need to do so that I can make good, what I consider to be good decisions. But and in fact, I always am most appreciative of anyone's suggestion, whether I agree with it or not. You can't know if you agree with it if you don't hear it. So I do pay attention to that. But I think bottom line on this, and I know that we need to move on because we have another public hearing, but I think bottom line on this is that this is not going to solve the problem that it was suggested that it would solve. We are not going to get, in my opinion, any significant increase in vaccination numbers. Because we do this, we are causing tremendous concern among most businesses and especially small businesses, and this should not, and I would not be in favor of it. Thank you very much, Mr. President.
Thank you. Councilmember Friedson, you'll get the last word before we move on.
Thank you, Council President. Thank you to colleagues, and thank you to those of whom testified, not just today, but throughout this process. You sent us comments. I didn't agree with all of the content necessarily. I didn't agree at times with the manner in which it was shared, but I think it's important that we hear from residents. And so I appreciate the fact that we did have additional public testimony today. And I do wish that everybody had as much passion for local government and local issues as those who have testified and who have shared their thoughts with us. I think this is a well-intended proposal, but I think it's very clear, not just today, but over the last several weeks since it was proposed, that there are a lot more questions about it than answers, and that it likely causes at least as many, if not more, problems necessarily than it would solve, particularly in a jurisdiction like ours. I've said before, I'll repeat that I think it's important that we lead by the power of our example in county government and not just the example of our power. And I think that the comments made earlier, particularly by Councilmember Navarro, about our education campaigns and other efforts and doubling down on those are really what we need to be focused on, particularly at this stage of this virus. We have leaned on residents and nonprofits and local businesses to help us throughout this pandemic, and are in a better position than nearly any other jurisdiction in the country because they have stepped up. And I think we need to continue with that approach in trusting our residents, who have overwhelmingly proven that they will do the right thing if provided with access to mitigation strategies, if given the proper information on how to keep themselves, their families, their employees, and their customers safe. And so I don't support this proposal. I'm glad that we're not going to be voting on it, but I did just want to close and say that just because I don't support this proposal, it doesn't mean that I don't support vaccines. And I started with my line of questioning about this proposal several weeks ago, and I will close about this proposal that vaccines undeniably work. Boosters are even better, dramatically in reducing severe illness and preventing death. And we need to continue to push residents and encourage residents, provide access to residents to get boosted, to get vaccinated if they aren't vaccinated, to make sure that you're testing in appropriate settings. And I do encourage and support those businesses, those nonprofits, and those residents who, for large events, ticketed events, large gatherings, are requiring testing and are requiring vaccines and are taking appropriate measures in order to keep themselves, their customers, their families, their friends safe. And so that's something that we should help with. That's something that we should encourage. We should provide additional access to. And I look forward to working with colleagues on the council and the executive branch and in the private and nonprofit sectors in order to continue to do that. I'll yield back to you, Mr. President. Thank you.
Thank you. I appreciate all the comments of my colleagues. Agree. Obviously, vaccinations are so important. They have been an important tool. It's just this measure, as you heard from all of my colleagues, there are significant concerns with right now. So we're now going to move on to the next item on the agenda, which is an introduction of a resolution to adopt the second amended Board of Health regulation to prevent the spread of COVID-19 and indoor mask guidance. We are set to have our current mask mandate expire on January 31st, and we acknowledged when we put forward this order that we would be reviewing this on the 25th, assessing the situation as it currently is on the ground, which we have assessed. And as we heard from our public health officials, the good news is the numbers are going down, but they remain high. And we are also continuing to hear from our public health providers, from hospitals, from those that are on the front lines addressing this issue, that although the numbers have lowered, there continues to be substantial challenges. And we also need to note as well, it's not just the spread, it's not just the hospitalizations, but now as we've entered into this next phase, it's the personnel impact and the exhaustion felt by the people who are on the front lines, who unfortunately in many cases are leaving the profession of nursing and of some of these other frontline positions. So this is a complex issue with a lot of different layers, and we will be looking at respective options this morning on whether or not to extend the mask mandate, and if we do, what that looks like. So Mr. Drummer, I'm going to ask you briefly, if you can, to give us an overview of the resolution before us, and then I want to thank everybody who has been waiting patiently for the public hearing. That will begin shortly, but Mr. Drummer, I turn it over to you to briefly give an overview of what we are going to be deliberating on right now.
Thank you and good morning. It is still morning. This resolution would, as you mentioned, extend the current January 31st termination date for the indoor mask mandate, which is a mandate to wear a mask in indoor areas in the county accessible to the public. The new termination date would be the earlier of February 28th, 2022, or when the health officer notifies the Board of Health that the CDC lists the following three indicators as both below high levels and trending down for 7 consecutive days. That's the number of cases per 100,000 residents in the past 7 days, test positivity rate, and COVID-related hospital bed utilization case rate. It would also make a small change. There's a commitment from the council to meet every 2 weeks to consider these numbers and whether the mask mandate should be changed. This resolution would actually change that to meeting every 1 week. And that's it.
Thank you very much, Mr. Drummer. Ms. Salou, are there speakers for this public hearing?
Yes, we have a few speakers for this public hearing. Our first speaker is Ms. Vanessa Lamers. Ms. Lamers, you have 2 minutes for your testimony. You may begin when you're ready.
Thank you. Good morning, everyone. Thank you for your robust discussion again this morning. I really appreciate it. Just want to comment that I believe the majority of Montgomery County is very much for the mask mandate, as am I testifying today. Many of us have children. We have elderly parents. We know that perhaps Omicron-specific vaccines are coming, but they're not here yet. We know, of course, that mask mandates protect the ability for schools to remain open, which is crucial for our communities and keeping our businesses running. We saw when we got snowfall that we weren't able to keep businesses open, and we've certainly seen that with county services in our neighborhood as well. I think also we talked about small businesses today, and it's crucial for small businesses to really have the county's support here in enforcing masks. Small businesses just do not have the ability to enforce mask mandates on their own. They really need the support of the council and of their community. And I also agree that access is a huge issue, as I know we talked a lot about vaccine access today, but mask access, we've seen people lining out the doors for tests and masks. People want masks. So the more that we can provide them and help people access them, that's going to help too. And then also this is everyone's choice to enter places that require a mask or don't. If you choose to not wear a mask, then you can choose not to go into places that masks are required. You can do curbside pickup, but ultimately it's our personal responsibility right now and our patriotic duty to be getting vaccinated and wearing a mask, as our hospitals are overloaded and our healthcare personnel just simply cannot take anymore. Thank you so much.
Thank you for your testimony. Our next speaker is Ms. Laura Want. Ms. Want, you have 2 minutes for your testimony. You may begin when you're ready. You need to unmute your microphone, ma'am.
I've lived in Montgomery County for over 35 years, and as a registered nurse with 30 years experience in clinical research, I've spent many hours reviewing COVID data and the science, both the medical science and the political science. I'm fully vaccinated, and I encourage others to be vaxxed, but I strongly object to vaccine and masking mandates. The council keeps moving the goalposts to end the mask mandate in order to keep it in place. First when 85% are vaxxed, then January 31st, and now setting different targets and pushing for another month. Even during times when people were not when masks were not required, many people chose to wear them. Why not trust residents to make decisions about their health and safety? The current mask mandate was reinstated in November, but that hasn't stopped the recent spike, which has been similar to counties in Virginia without mandates, and now in all counties, it's dropping rapidly. Vaccine and mask mandates harm businesses, as I, along with many other customers, choose to shop, dine, and patronize businesses in other locations without such mandates. This also reduces county tax revenue. Recently, over a year after the DanMask 19 data showed the same, the CDC finally admitted that most masks do not provide much protection from COVID. Now the county's distributing N95 masks to residents, which may only provide a false sense of security. They're more effective, but only if properly fitted, worn, and changed regularly. Even 1 day's beard growth prevents a tight seal and allows virus particles around the mask. Will you require that all beards be shaved daily so that masks will be more effective? As I look at council members, I see that this would affect some council members with facial hair. I urge you to vote no on the amended regulation and stop pretending that masks will stop COVID.
Thank you for your testimony. Our next speaker is Ms. Bethany Mendel. Ms. Mendel, you have 2 minutes for your testimony. You may begin when we are ready.
Thank you. Over the course of the last week, the libraries have been distributing N95s to residents. We're one of the most vaccinated counties in the country. Here's my question. Why don't you believe in science when it comes to masks and vaccines that you are distributing? Yesterday, businesses in Kent Mill, there was viral videos made of customers refusing to mask. It's wrong. They berated the staff who are stuck enforcing the mandate that you have imposed on them. You've made minimum wage workers into human shields. The county is using the mask mandate as a harassment tool, sending its inspectors to local synagogues on Shabbat. Not a good look. On December 17th, I was on a Zoom call where I heard the following. The powers that we have exercised as a Board of Health and as a county are extraordinary. These are not normal government powers. He went on. I think it's up to us to prove why we should be exercising these powers in order to keep people safe. That was you, Andrew Friedson. This council has completely broken its trust with residents on this issue. It's why you've heard from residents more in the last month than you ever have over the course of your careers. It's how we've quickly amassed over 1,000 county residents in our group, find us on Facebook, Revive MoCo, to try to push people back into the background, to try to push you people back into the background of our lives and to regain normalcy in this county. Your goal as local politicians should be to have been unobtrusive and unnoticeable. And we notice you now. We notice the photos of you that we've seen and made go viral on social media at indoor events where all of y'all were unmasked as toddlers spend their days masked. We notice the constantly changing goalposts and metrics when this mask mandate is extended over and over, and the refusal of this council to let go of these extraordinary powers. We notice the time that you spend on these trivial issues instead of on crime and on school safety. C.S. Lewis once said, it would be better to live under robber barons than under omnipotent moral busybodies. The robber baron's cruelty may sometimes sleep, but those who torment us for our own good will torment us without end, for they do so with the approval of their own conscience. Ain't that the truth?
Ms. Mendel, your time is up. Thank you for your testimony. Our next speaker is Mr. Rob Van Alstyne. Mr. Alstyne, you have 2 minutes for your testimony, and you may begin when you are ready. Is Mr. Alstyne with us?
I believe he's not.
Okay, I'll move on to the next speaker. Our next speaker is Mr. Tyler Jeffries. Mr. Jeffries, you have 2 minutes for your testimony. You may begin when you are ready. Mr. Jeffries is not with us either.
No, he's not.
Okay, I'll move on to the next speaker, Mr. Noam Katz. Mr. Katz, you have 2 minutes for your testimony. You may begin when you are ready.
Hello. Ladies and gentlemen, my name is Noam Katz. I'm an attorney and homeowner here in Montgomery County. When speaking on the question of whether or not to extend the COVID-19 mask mandates which expire soon, spoiler alert, we should not. Let me explain why. The science has changed. Experts, including Dr. Liana Wen and the CDC, recently issued public guidance recognizing that current mask-wearing practices, often with reusable or cloth masks, are largely ineffective against the Omicron variant. Now, only stricter masking practices, like close-fitting N95 masks, can be relied upon to provide meaningful protection. Published sources have been uploaded in written form. This puts us at a three-way crossroads. One, as proposed, we can extend the same mask mandate. But this time, instead of following the science, we'd be knowingly contradicting the latest settled science, because so much of what is permitted under the rules we now know does not work. And once unmoored from science, what then is informing our decisions? Two, we could upgrade the rules to mandate the best practices identified by the one in the CDC. The county has not even proposed this, and for good reason. It is folly to attempt to legislate the impossible. There simply aren't enough N95-like masks available for everyone to wear one constantly and replace it as frequently as required. If we tried that, we'd run out of high-grade masks promptly. I've also seen that many folks in this county don't wear their current masks tightly fitted without gaps. It is folly to assume that the uncomfortable or uncaring will fix such errors even if they upgraded to N95s. Attempting to double down on the stringency of mask mandates while having some scientific self-consistency is fruitless as public policy. Which leaves the third and correct option. The mask mandate should lapse. Cases and positivity rates are now in free fall. Hospital utilization rates are officially low. Check the website. Residents still worried about COVID can wear their own highly self-protective N95 masks and will enjoy an easier supply because such masks won't be wasted on people who won't use them properly. People who need protection can and have obtained it for themselves. Shops and bars shouldn't be the unpaid mask and vax police. 2 weeks to slow the spread has now become 2 years of living in what is now needless fear. It is time to go back to our normal lives. I welcome any questions.
Thank you for your testimony. Our next speaker is Mr. Harold Maldonado. Mr. Maldonado, you have 2 minutes for your testimony, and you may begin when you are ready.
Good morning, and thank you for your time. I'm against extending the mask mandates for several reasons. I'll point out to those. Masks don't work. Recently, the state Supreme Court judge in New York ruled mask mandates to be unconstitutional. Florida is thriving without any mask or vaccine mandates. Masks are unhealthy. Masks are causing developmental issues for kids. There's a surge in childhood speech delays. There's a rise in learning issues. There's a rise in suicides. Look what happened in Magruder High School. And I'll point you to following the science. Fauci co-wrote a paper in 2008 on the Spanish flu. And his key findings were people didn't die from the flu. 98% of deaths were actually caused by bacterial pneumonia. Bacterial pneumonia was caused by people wearing masks. You know the truth. You know the data. Masks don't work. Vaccines don't work. You're lying to the public. We will remove you from office. You're frauds and criminals. You should all resign. If there's a pandemic, where's the proof? If there's a pandemic, why is the PCR test being removed by the CDC as a test option? How much are you getting paid? You will be tried for treason and crimes against humanity under the Nuremberg Code. I suggest you start retaining legal services. You're destroying this county that once was a model for Maryland. Enough of the tyranny and the mandates based on made-up data and medical lies. Thank you.
Thank you for your testimony. Our next speaker is Ms. Jerry Yan. Ms. Yan, you have 2 minutes for your testimony and may begin when you are ready.
Can you hear me?
Yes,
Hello?
we can hear you. We can hear you.
Oh, thank you. Thank you for your service to Montgomery County. Thank you for giving me the opportunity to testify here. I'm against face mask requirements for the reason below. I'm running a nonprofit educational service providing foreign languages and cultural dances. Student ages are from 2 to 95 years young. Wearing masks is extremely hard for students to learn accurate word pronunciations and tones and dances in classroom too. Online teaching works on some students, but not all, especially those with various disabilities. The result is not as good as that from the classroom due to network restriction, concentration issues, room conditions, fun way of teaching and learning, etc. I'm asking the council members to hear our sad voice and stop face mask requirement as soon as possible. Our students of all ages are innocent but become the direct victim of the face mask requirement. Requiring face masks does not show benefits, but a huge waste of taxpayer dollars, leading people, business visitors, and police, and does not comply with the United States and Maryland constitutions on liberty, right of choice. The county's free artificial criteria to put on or remove face masks is not proven to prevent transmission, spread, or stop the virus at all, not to the vaccines as well. The county executive Mark Ayers is the best example of having free vaccines and wearing masks all the time, but still catching the virus. The real data across the globe in 2021 versus 2020 shows that vaccines, masks, and virus are three independent entities. Thank you for allowing me to testify. Your wise decisions to vote no and withdraw face mask and vaccine requirements, I really appreciate it. May God bless Montgomery County and us all. Thank you for your time.
Thank you for your testimony. I see that Mr. Alstein has now joined us. Mr. Alstein, you may begin your testimony when you are ready, and you have 2 minutes.
Thank you guys for the time, and sorry for the delay getting on here today. So I once again come on here and oppose the extension of a mask mandate. Quite frankly, the data shows that mask mandates aren't doing absolutely nothing to stop Omicron anywhere in this country, anywhere around the world. And at this point, we've had vaccines now for 14 months almost, and the county is fully vaccinated. There's nobody else out there that you're really protecting. Our kids, if they're in school, they can be vaccinated. Their parents have had the chance at this point to be vaccinated. It's really damaging our kids. It's damaging businesses. It's not really promoting public health, and there's really no reason for it. If you can show me a city or a country where face masks are actually stopping Omicron, you would be the first one I've ever seen. So once again, it really is time for the county to move towards normalcy, because everybody else's, especially the most vaccinated county in the country, really, really does deserve to have normalcy. Thank you very much.
Thank you for your testimony. And that wraps up our speakers for this public hearing. Mr. Council President.
Okay, that concludes this public hearing. I don't even know where to begin. Let me just make a couple of comments. The first is, I think there isn't a person I know, including me and my family, that doesn't want to return to normalcy, but we had to ask the National Guard to come in and provide bus drivers for our school system just about a month ago. We are not in normal times. I know there's a dispute with regards to whether or not masks work generally, particularly depending on the type of mask. But I think when you look at the overall data, our jurisdiction as compared to others, especially one as large as ours, I think has fared better in terms of our death rates, our hospitalization rates, in part because of vaccinations, in part because of masks, in part because it's frankly our residents that have stepped forward and really stepped up in ways that are very significant. I know there's been, again, a lot of anger and frustration expressed in this particular public hearing as well, and I know that it exists out there as well. But I also know that there are many of our residents who do continue to wear masks and will do so regardless of what we decide this afternoon. But it's also important to note, as was noted by one of the speakers who spoke, is that having this across the board does provide our local businesses in a better position to not have to selectively police these when it's something that's done holistically across an entire community. And as was stated earlier during our public health briefing, the numbers are going down. But even with them going down where they are right now, they still remain high. And so that's what's before us today, is to discuss the current situation that's on the ground. And so I look forward to this discussion. Mr. Drummer, if you can review one more time, just based on the order that has been presented, what's on the table for us to discuss this afternoon. And then I'll open it up to colleagues for comments before we move on to making a motion on whether or not to support all or part or some of the order as has been recommended by our public health team. Mr. Drummer.
Okay. This is a public health order that would be in effect throughout the county. You currently have an order that has this very mask mandate for indoor spaces accessible to the public, is currently enforced through January 31st. When you extended this order back on January 4th, you indicated that you would continue to look at the numbers every 2 weeks. The numbers actually skyrocketed from November 4th and have now started to come down. As you heard this morning from the public health team, the numbers went from astronomically high to very, very high. They haven't come down to low. They're still in high transmission. They're still well above high transmission. So what this public health order would extend that termination date from January 31st to either the earlier of February 28th, or when the numbers come down and the public health officer notifies the Board of Health that the numbers have come down below high transmission for a period of 7 consecutive days, the numbers being the number of cases per 100,000 residents in the past 7 days, the test positivity rate, and COVID-related hospital bed utilization case rate. If the health officer, or if these numbers don't come down, this resolution would expire on its own terms without any further action on February 28th. It also includes a commitment for the council to review these numbers and meet every week in the interim to see if this needs to be continued.
Thank you, Mr. Drummer. I see that Dr. Bridgers and Mr. O'Donnell are still with us. If you guys can turn on your cameras just in case my colleagues have questions or comments as a follow-up. Dr. Stoddard is here as well. Councilmember Friedson has requested to speak. Councilmember Friedson.
Thank you, Council President. Thank you, Dr. Bridgers, Dr. Stoddard, for taking the time to speak with me about this and related issues. I had a question to follow up previously. It really does relate to what's before us, so I'm going to ask it now. One of the metrics that was used in the proposed order is case counts as a primary indicator. We discussed earlier about case counts as a primary indicator. It was noted this question of the need to move from pandemic to endemic. Dr. Bridgers, Council Vice President Glass, noted that as well. Just wanted you to explain to us whether or not case counts at this point are an appropriate measure, particularly once we get through the Omicron surge, which, as you noted earlier, would be expected, by middle of February. So I think it's related to this measure and the timing of it and the metrics that you've included. So if you could share your thoughts on that, specifically case counts versus hospitalizations, or other measures.
Sure. Thank you, Councilmember Friedson, for your question. I'll begin. So CDC uses two primary level indicators as far as community level transmission, one being case count per 100,000, the other being test positivity. Based on that explanation and my reread our team's reread is that the preference is case counts. However, we know that when there's a variance between case count and test positivity, CDC directs us to go with case counts. So in speaking of moving from a pandemic posture to an endemic posture, case counts will continue to be a primary indicator, but not the catch-all be all, if you will. We want to know the level of communication as a primary indicator, but we want to look at those other metrics that may be impacting a resolution or proposed regulation, such as hospitalization usage. Council President Albornoz talked about the conversations that we've had with our hospital Nexus Montgomery system and looking at those intensive care units where we see folks, patients still being admitted to ICU, but also how it impacts not only the available staff to respond to that ICU beds. And so in looking at this proposed regulations, case counts will continue to be one primary indicator, but we need to look at other secondary and tertiary indicators as well, as we've talked about this morning during the council session as the Board of Health, such as bed utilization, staff to bed ratio, acute care units as one indicator. And as we see those numbers decrease from a high transmission, community level transmission to a moderate or low transmission level, we will continue to monitor those absent of the case count because we know that we still may have a moderate level transmission, but we still may have high utilization. So in those comparisons, some of that was put into the discussion regarding this proposed regulation.
The only thing I would like to add is if you notice the measures that were offered, they are substantially different from previous measures that have been offered. Meaning, we've said, previously we talked about moderate transmission, low transmission as being targets. We've raised that level to say if it's below high, which there's a high, significant, moderate, and low. So if it's below high, so if it gets into significant and it's trending downwards, we were willing to consider that as a reasonable threshold, given that, as you noted, and I've previously testified, case counts should matter less as we vaccinate more people. But mattering less and mattering not at all are two different things. And so I think we're suggesting we've significantly raised the threshold where we're talking about having this, recommend that this be lifted, and including hospitalizations, as we previously have both testified we should be doing. And so I think it's not just a matter of should we ignore case counts or should we ignore case test positivity. It's that our thresholds for considering those things should be higher as we have a higher, more highly vaccinated population.
Yeah, I appreciate that, and I appreciate the inclusion of metrics, which I've been talking about quite a bit in this. I think my concern is there's a difference between ignoring something and using it as a key trigger for major, arguably extraordinary public policy. And so I do think that we need to continue to think about, obviously, from a public health standpoint, anytime there's significant transmission of any virus in the community, that's something that our public health team, we know, are going to be monitoring, and we're going to be sharing information with the public. I think the question is, as was stated earlier, moving from pandemic to endemic, at what point do we make that transition? I think we need to have a serious and honest conversation with residents to determine that. And I, will just say that, I think when we have trusted our residents to do the right thing as part of our prior conversation as well, they have overwhelmingly done it. I think we need to go out of our way to try to, trust residents to do the right thing. The decision of 1 month versus 2 weeks, could you just explain why the 1 month was used rather than 2 weeks? We had made a commitment previously to say that we would meet every 2 weeks and identify the data. You talked earlier about how you believe by mid-February we'll be through Omicron. One of the reasons why this was reinstated as an indoor mask mandate was to get us through the Omicron surge. Could you just explain why the 1 month versus 2 weeks and why we wouldn't meet in 2 weeks, after this and make a determination based on your advice and guidance and the metrics that you've set of whether or not it will continue?
Sure. Thank you, Councilmember Friedson, for that question. So why 1 month versus 2 weeks? The council has been sitting with our public health team and others on a weekly basis just to assess community level spread, to assess all of those primary, secondary, and tertiary indicators. As we talked about, we've also had previous discussions where we've elected to adopt an off-ramp, on-ramp, a percentage of community that's fully vaccinated. And in those proposed regulations or adopted regulations, we saw some variance. And so in looking at the lessons learned from the adoption of those policies and or regulations, and looking at the trend analysis of the current Omicron surge and downward decrease, we wanted to have a level of flexibility. So we wanted to move away from a biweekly assessment to a weekly assessment to look at those measures and those metrics and those indicators that we've proposed in the regulation. We also, based on our analysis and research investigation and statistical modeling, we wanted to have some flexibility and variance to allow for any data anomalies, data reporting anomalies. We've experienced some of that in some of our previously proposed regulations. So that was the premise for having a 30-day recommendation versus a 2-week recommendation, with the understanding that it may be less of a period based on the data, trends, and analysis.
I appreciate that. Just out of curiosity, besides situational awareness, meeting every week, when we have a 4-week, or actually longer, slightly more than 4-week extension, what would be the purpose? What would be the goal besides situational awareness to the council as the Board of Health and the public?
Sure. So as we continue to meet weekly, sure. So as we continue to meet weekly, we will provide the recommendation to council from the health officers purview to recommend that, or to inform the council sitting as a Board of Health that our metrics have been reduced to a level that's either in a more protective posture, if you will, or less severity, as opposed to extending out to 28 days. So the actual proposed regulation could end sooner if those data, those metrics continue along that trend line for 7 days.
Appreciate that. So just for colleagues, appreciate the rationale behind it. I don't think I'm as far apart potentially as it might seem, and certainly based on our conversations, Dr. Bridgers, I did originally suggest that we do a 2-week period, and look at it every 2 weeks. That was originally part of my preference. I still think that would be an appropriate preference here. I think it's in line with the modeling that has turned out to be accurate, and with where the numbers are headed, and we'll see where colleagues are, but my preference would be if we were going to extend it by 2 weeks, to meet every week, to hear the numbers, to have the situational awareness as you described, and to actually have that flexibility to make a decision of whether or not we would extend beyond one last time for those last 2 weeks, based on where we are, where the numbers are, and how things are looking. So I'll yield back and appreciate your indulgence, and look forward to hearing from colleagues.
Thank you, Councilmember Friedson. Just speaking for myself, a couple thoughts here. The first is, as was noted, while I appreciate trying to establish some benchmarks that we can then more publicly disclose, so that there's a little bit more predictability, people can track the numbers themselves, see where we're going. I am concerned about those anomalies that Dr. Bridgers mentioned in the data collection. Just the hack alone at the state level is a good example of how the numbers, we're at the mercy of the collection of the data, and we don't always know in real time. I think it has been reliable, especially over the course of the entire period, but there have been those anomalies which give me personally a little bit of pause in establishing benchmarks based on those numbers, because they've just been challenging at times to understand, and again, out of our control. I do think that, and for context for the public, and we've said this before, but it bears worth repeating, the reason we established a date certain to reevaluate this and or end it was because of the feedback that we had received and the concerns that if we do this in perpetuity, even though we're reviewing it every 2 weeks without setting a date, it sends the message that this is going to go on forever. And it's not going to go on forever. And so that's why we keep revisiting this, hoping that things will subside, but knowing that they may not. And I think when we enacted this earlier this month, I think it was pretty reasonable to predict that the numbers would go down, but not to the point where we felt entirely comfortable totally alleviating the mandate. So I'm somewhere in between Councilmember Friedson and the 28th personally. I think 2 weeks is probably going to lead to more frustration, as we heard in some of the testimony this afternoon, that if we set a date and then have to move it again, that won't be enough. The 28th seems pretty far enough removed from the projected numbers and where we think we are, but maybe it's a little too long, and that's why I know you guys tried to present the benchmarks to maybe end it earlier than that. But again, I'm concerned about those numbers and whether or not they're realistic. The 21st seems like a better and happy medium that takes into account those issues laid forth by Councilmember Friedson, providing a long enough runway, but a date certain, far enough removed, that I think, based on the projection of the numbers, is more realistic. So that's kind of where I'm at the moment. I'm open to the 28th. I don't support the 2 weeks because I think we're just going to be right back where we are right now. But I think something in the middle is something I'm a little bit more comfortable with. But do any of my colleagues wish to speak to this right now? Councilmember Reamer.
Thank you. I have long believed that we don't need to have specific benchmarks in our regulations. I know why they've been requested, and I understand that. However, I think that the trajectory here for the council is also, clear. And so in general, I think I really believe and I expect that this extension would be the last. I was comfortable with the end of the month because I'm reasonably confident that cases will have declined. I don't know about these metrics. I agree. I think it's quite possible we would find out that for whatever reason, we just haven't quite hit it. And to me, for that reason, I think it might just be better not to have a metric and to examine the facts on the ground as they really are. But I am optimistic about where we'll be, a little bit more than a month from today. And, people hoping, I think Omicron, we're all hopefully the level of infection will have created such immunity that we're going to be in a much better place, in March. So we would be happy to reduce this. That's my general desire, but of course that's not, we have to take it one step at a time. So I was okay with the end of the month, but I was also wanting to explain that I really did expect that would be kind of where it would end. But I'm flexible here also. I will signal that as the council president did. But I generally think, avoiding benchmarks would be better. It'll just make it clearer that we are working based on the facts on the ground as opposed to any particular set of numbers.
Thank you, Councilmember Reamer. Council Vice President Glass.
Thank you, Mr. President. And I appreciate the way that you frame this conversation and the thoughtfulness, because it's not easy. And we've been muddling our way through this, trying to keep everybody healthy and safe for a very long time now. And I know that we are all ready for this to be over. And the metrics and the data at this point in time are indicating that that will happen in the near future. And I'm ready for it. I'm ready to return to the gym and not have to mask up. I'm ready to go to the restaurants and not have to mask up. But right now, we need to do those things because the science and the data are suggesting that that is the best practice, and the CDC is suggesting that is the best practice. What we're talking about now regarding the end date and whether to re-up it, I expressed this concern earlier this month when we extended the mask mandate and we put a date on it. And some folks had been calling it an off-ramp, and I said it's not an off-ramp, it's a flashing yellow light, to continue that transportation metaphor. And what I have concerns about is if we add another date to yet another regulation, it just gives yet another false sense of direction. And I would rather we have these conversations every 2 weeks, every 1 week, whatever it might be. I'm satisfied with every 2 weeks, but I would be satisfied having this conversation every 2 weeks, looking at the information at that point in time, looking at guidance from the CDC and making that determination, because otherwise we're going to keep having this conversation. Every single time this council has put a date or a metric, we have continued having the mask mandate. So we just need to be honest with ourselves and with all of our constituents about what sense of guarantee we are providing. And for me, I just continue looking at the CDC and trusting in our nation's top scientists and doctors and looking at their guidance. And so, again, I appreciate, I guess, everybody who's spoken thus far recognizes that the directive as written is not perfect. But I would prefer to remove the date and increase the number of conversations this council has so that we can determine in real time. Thank you.
Thank you, Council Vice President Glass. Councilmember Katz, and then Councilmember Friedson's back in the queue.
Thank you, Mr. President. And I thank all my colleagues once again who have spoken, as I do the professionals who are giving us the advice. Can you please remind me where the other governments are on this issue? Where is the District of Columbia? Where's Prince George's County? Do you know I have a feeling you might know off the top of your heads. Can you please tell me?
Sure. Absolutely, Councilmember Katz. I'll just go down the list. DC mandate runs until the 31st. They are considering whether or not they will extend beyond that. I haven't heard any updates via our health officers meeting on the Council of Government, which is scheduled, I believe, next week. Schools go through June based on MSDE. Virginia has no mandate with the new elected Governor Youngkin. It's still continued for schools. Anne Arundel is scheduled to end on January 31st. Prince George's runs until March the 9th, and haven't received an update, but expect to receive an update from Howard, which started on December 26th, but it didn't mention an end date. That's the listing that I have as of yesterday.
Okay. Thank you. And we all, our goal here, everybody says we keep moving the goalpost. Our goal was to get rid of these masks. I mean, that's our goal. But we want to get rid of it in the safest and manner that we can possibly do it. I'm somebody that believes you do need an end date. And I understand that we've changed it a couple of times. We've based it. We tried our best. We were off the mandate for about 22 seconds there, and then of course the numbers went up, and therefore we brought it back. But I believe we should have an end date. I can live with the 21st. I think that is logical. Of February 21st. I believe that there should be, if the numbers go down, that it's automatic. Once that happens, that it automatically is over, and that's the way we should do this. The fact that our partners, our neighbors, the governmental partners that we have who are our neighbors, are all over the place on this doesn't make it any easier for us, because obviously people go from jurisdiction to jurisdiction, and it's not helping the situation. So I guess bottom line for me is I could live with the 21st, and with the caveat that if the numbers go down, then it's over. That's where I am on this one. Thank you. Thank you, Mr. President.
Thank you. Councilmember Friedson again, followed by Councilmember Navarro, and then Councilmember Rice. Councilmember Friedson.
Thank you. Appreciate comments of colleagues. In the interest of compromise, if there's consensus, I'd prefer it to be shorter, but there's consensus on an in-between for the 21st. I would be willing to go along with that. I wanted to note the 21st would take us through a holiday weekend. So that's a Monday, but it would take us through the holiday weekend. So just wanted to note that. I think that there's some sensibility to that date, in particular. So I just wanted to note that. And then also there's a suggestion about the metrics that are being used. And, I do think that it's important that metrics be shared. So if the metrics aren't going to be a trigger here, and, I do think that we should include metrics in the order. I just think we could move them as part of the weekly meeting and reporting by the public health officer, as opposed to in the termination clause. And I do recognize, as colleagues have shared, that that might make the trigger for this a little bit cleaner and easier for residents to understand. And I did want to share that I agree with colleagues that have already shared that the goal here is for this to get us through the Omicron surge, to give us a little bit of breathing room beyond that, and for the mask mandate to not be in effect any longer. And so I just wanted to note that. I think there is some concern that we put the dates down and then we keep extending the dates without clearly stating what our objectives are for why we're moving them. I think if we have the metrics in here, I think that would clearly show what the intention is and the goal is. And then I think, hopefully we can move forward. And I think in the intervening weeks, we need to have the conversation of moving from pandemic to endemic, what level of risk and tolerance we're willing to accept, how we're going to make sure that residents have the information they need to keep themselves or families safe, what businesses can do to keep their employees or customers safe. So I'm going to move I will move both of those, if there is a second, both making the date earlier to the 21st at 11:59 p.m. and moving the metrics from the termination to the reporting by the public health officer to the council on a weekly basis.
We have a motion. Is there a second?
Second.
Second, Councilmember Navarro. And Councilmember Navarro, did you want to speak to this particular amendment? You were in the queue before Councilmember Friedson made his motion, or did you want to speak to something else?
Well, I want to retain my right to speak. I can do both, I guess. I don't know. It's up to you, Mr. President.
That would be great. If you could to the amendment, and if you want to add the other component as well, that's great.
Thank you. Before the amendment was moved, I just wanted to, express my views as all my colleagues were expressing their views. I think that we don't have a crystal ball. And, we have been making decisions based on CDC guidelines and responding to unexpected waves like the Omicron. So I know Councilmember Glass mentioned that somebody said something about an off-ramp. I was one of those people who said that. Maybe, English is not my first language, but my point of doing that was to say that we should have a date certain that we can then reevaluate, because we don't have a crystal ball. Things have changed. and we have to respond. That's our duty. It may not be perfect and it may not be comfortable, but that is why we are elected and why we are the Board of Health. If we have to confront another wave of another variant, then we have to respond to that. It's just kind of like why we're here. So I do believe that it would be important to set a date that we can, at that point, evaluate the issues, the numbers, the metrics on the ground. And if everything seems good, it looks like things are trending in a good direction, then that's awesome. Then we just lift it. If for some reason, heaven forbid, we're hit by another variant of some sort, then we're going to have to reevaluate. I mean, nobody enjoys doing that. It's just what we have been dealt and what we have had to do. So in the spirit of compromise, I think 21st is fine. I mean, that would have been fine aligning with what other jurisdictions are doing so we can have consistency. But if, in the spirit of compromise, I think I'm fine with that. And hopefully we don't have to continue to do this. But like I said, I'm cautiously optimistic, and absent a crystal ball, we do what we can with whatever we are confronted, which is why we are the Board of Health. Thank you.
Thank you, Councilmember Navarro. Councilmember Rice, you were in the queue. Did you want to speak to the amendment or? Okay, go ahead.
I'll do a kind of a hybrid, and I'll just echo the comments of my good friend, Councilmember Navarro. I couldn't agree with her more in terms of everything that she just said. Look, if the numbers are up, if things are really concerning for us, we'll need to keep it in place. And if the numbers continue to trend down and they're looking good, we'll remove it. We were ready to remove it. We were all excited about the fact that we were going to remove the mask mandate. It was going to be gone. I mean, so again, for folks who think that somehow there's some kind of gain by us having the mask mandate, trust me, every single time, just like Councilmember Glass goes to the gym, I hear from all of my folks at LA Fitness, Copley Square in Gaithersburg, every time who tell me, Craig, when are we going to get rid of the mask mandate? Craig, when are we going to get rid of the mask mandate? As we sit on treadmills or jumping rope or lifting weights, mask, right? So I get it. I understand where folks are coming from. But again, this isn't some personal pleasure that folks have in terms of instituting a mask mandate. This is something that we're doing to try and keep people safe. And I hope that people just understand that and just bear with us. My good friend, Councilmember Navarro, said something about grace. And I really hope that our constituents, that our business owners, that our, folks as a whole can just institute a little bit of grace in understanding that we are in a challenging time. We don't know what tomorrow holds. And we're just trying to react and make sure that we're responding in a way that makes sure that everyone is safe. That's what we want. And so by doing this, by utilizing the compromise that Councilmember Friedson put forward, I think that we continue to get there. We continue to make sure that we're mindful of what we're seeing on the ground, and also being flexible in terms of ensuring that once we do see some progress that's headed in the right direction and becomes a safe metric for us, we can actually move forward with removing the mask mandate. Thank you, Mr. President.
All right, thank you. So we have a motion on the floor, seconded by Councilmember Navarro. Councilmember Friedson, the motion, just to make sure I understand, is to move up the date to the 21st, and that the benchmarks remain, but not be formally the decision maker on whether or not we move it up, but that they be used as a discussion point as we meet every week anyways, sitting as the Board of Health, to provide a more definitive guideline as we have that deliberation. I know that was a mouthful, but I just wanted to, and maybe you can summarize better than me, but just wanted to make sure I reflected your motion correctly.
Yeah, I think you generally did. Why don't we turn to Mr. Drummer to make sure that he understands it, and then I can clarify the confusion if that works for you, Mr. President.
That's a much better plan, Mr. Drummer.
All right, so we would be changing the termination date on lines 88 through 96 to simply say, this regulation will terminate without any further action by the Board of Health on February 21st, 2022 at 11:59 p.m. Then we will take the indicators that are in lines 90 to 95 on the regulation and move them up to lines right after line 51, where it talks about the Board of Health must meet every week to review the data provided by the health officer on community transmission of the virus and consider whether the indoor mask mandate must continue. Then I would say that the health officer must provide or must notify the Board of Health on the following indicators and then list those 3 indicators.
Yes, that was the intention.
Great. Council Vice President Glass wanted to get in, and then we'll vote on this amendment. Council Vice President Glass.
Sure. Thank you. Thank you very much. So the comments I made earlier just about the hesitation I had were really not my objection to this proposal made by Councilmember Friedson, and I will support that. It was just that I prefer a different strategy. And I prefer one in which we have a more constant conversation so that, quite frankly, if the data indicated that we could take the masks off and end the mandate sooner than that set date, fine, then let's do that. And if it needs to stay on longer, then we would do that as well, because that's what we've been doing. And every time we put metrics and every time we put dates, it seems like it is Lucy pulling the football from Linus. And I just want to make sure that everybody has their eyes open, that we are doing the best we can. And Councilmember Navarro, I do appreciate your comments. You're spot on about a crystal ball. And my comments about an off-ramp was not about any comments made by any of us here on the council. It's what I've been seeing in social media. And I know that there's going to be disappointment that we are continuing to have the mask mandate. We know that's happening, and there's going to be an expectation that it will again terminate at yet another date. And I just want everyone to know what we're doing. And again, Councilmember Navarro, you stated it quite well. And so I will support this. I would prefer a different strategy to get to the same goal that we all have, but here we are. Thank you.
All right. I think not letting perfect be the enemy of the good might be the headline. All right. So we've got a motion on the floor with a second. Oh, Councilmember Reamer.
I just want to stay for the record. I would have preferred the 28th. I just think it's a little better, a little risk averse that we would have to extend it by giving us one more week as a buffer for transmission to be declining. But I am not going to, I will nevertheless support this. I just think it could be a little uncomfortable on the 21st, but okay.
All right, we have a motion on the floor with a second. All those in favor of Councilmember Friedson's amendment, please raise your hand. All right, that is unanimous. Now can I get a motion to move forward the public health order as amended?
So moved.
Moved by Councilmember Rice, seconded by Council Vice President Glass. All those in favor of moving the public?
This is a roll call vote.
Oh, sorry, roll call, my bad. Go ahead.
It's okay.
Madam Clerk, please call the roll.
Mr. Friedson?
Yes.
Mr. Friedson votes yes. Mr. Durando?
Yes.
Mr. Durando votes yes. Mr. Reamer?
Yes.
Mr. Reamer votes yes. Ms. Navarro?
Yes.
Ms. Navarro votes yes. Mr. Rice?
Yes.
Mr. Rice votes yes. Mr. Katz?
Yes.
Mr. Katz votes yes. Mr. Hucker?
Yes.
Mr. Hucker votes yes. Mr. Glass?
Yes.
Mr. Glass votes yes. Mr. Albanos? Mr. Albanos votes yes.
Thank you, Madam Clerk. Let the record show that that public health order passes unanimously. We now move on to the next item on our calendar before we go to our recess, and that is the approval of the consent calendar. Can I get a motion to approve the consent calendar?
So moved.
They're moved by Councilmember Rice, seconded by Councilmember Katz. Any discussion on the consent calendar? Hearing no discussion, all those in favor of the consent calendar, please raise your hands. And that is unanimous. So with that, we are now adjourned for recess. We will be back at 1:30 for public hearings. Thank you all very much.
It's been a very stressful experience. And all of a sudden they're back in somebody's warm home with, a lovely bed or couches or beds to lay on. And they're like, oh, I can take a deep breath and I'm relaxed now. And this is great. This person has